gets to the
is presented to
Wi-Fi.
us. I don't have that packet, I'll get it.
I don't know what.
Good evening. Calling to order the City Council Conference, Tuesday, January 10th, 2023. One item on the agenda. Item number 1, discussion regarding mental health crisis response. Sir, I don't know your name, but apparently you're here to give us some information.
That I am.
All right. Would you introduce yourself to us, please?
I sure will. My name is Ron Sims. I have the honor of serving the people of Oklahoma as Chief of Statewide Crisis Services for the Department of Mental Health and Substance Abuse. Should I just jump into it?
Yes, sir. I
All
will.
right, great.
There'll be questions that come from council. You'll see them raise their hand, and I'll ping them, and then they'll ask you those questions.
Sounds good. I'd like to begin the presentation by saying, well, I've worked for the department for about 15 years. And I have been serving as executive director of the 2 state-operated crisis centers in Oklahoma City and have been promoted to this role relatively recently. So I didn't work directly with Shannon Hatchett, but I did know her. And she was really well liked and had such a joy about life. And it's heartbreaking when we lose anyone, but it's absolutely devastating to lose someone that we considered one of our own. So I needed to say that.
Thank you.
Also, I want to say, I've worked for years in Norman. I worked at Griffin and I worked at Central Oklahoma. And I've always found Norman PD to be good faith partners and wanted to do the best for whatever situation that they were working with us on. And so I'm really excited to be here today because we've really been working really hard on expanding our crisis services and our crisis network. And so we really have some great things to offer the community that are already in place. And so I'm really excited to have this opportunity to speak about that. So without much more mumbling from me, let me just jump right into it. All right, so just FYI, I'm notoriously bad with PowerPoint presentations because I'll just talk to you and I forget that I'm even doing a PowerPoint presentation. So bear with me a little bit, but this is what we're kind of overviewing. The components of our crisis network are 988, Mobile Crisis Team Dispatch, Urgent Recovery Centers, Crisis Centers, Inpatient Hospitalization, and Outpatient Services. So that's kind of the encumbrance of our crisis network. All right, let's see. So our, was that? Oh,
If you want to run it.
all right. We'll just give you a little introduction by the commissioner. Well, Jeff, do you want to?
Try to right click it over. Oh, just hit that.
Sorry.
Go ahead and hit that. Don't know what that is. It's been doing that lately. There you go.
All right.
Let's see if it'll play. Oh, we got sound. It's not playing it.
It's dual screen, so you gotta slide it over.
Oh, you got to slide over. I need your help.
Can we get this on in the overflow?
I'm asking
Here,
you
I'm
to
going
do
to
that
stop
now.
this right for right now.
Do we
Yeah, yeah, you go ahead.
Here, let me scoot out of the way.
If you'll slide the window, should
Yeah,
get
sure,
you
sure.
squared away. Dual screen.
Other duties as needed.
Right.
There we go. You realize you're going to have to get us out.
Yeah, man, it's one-handed he does that.
Is there a sound?
See what the sound
Bring-
is.
See if you can bring
That's
it up.
Brenda's.
Or dispatch a mobile crisis team out for added support for that individual who, if they are not able to give all the assistance that that person needs, they can request additional support or take that person to the additional care that is needed right then and there. Now, the other thing that is part of a comprehensive crisis system is that number that you called originally, they also play a role in after a crisis has happened. and that they reach out then the next day, they make a call to make sure, did you have any trouble getting to your appointment? Are you feeling better today? What else can we do to support you? Have you found the help and care that you need? Were you able to make the changes in your living situation that were needed, if that's the case? So they reach back out and do follow-up of each and every person that they have talked to make sure that things are progressing in the right way. Well, I think it's incredibly important because people deserve the best care, the right care when they need it. And years ago, although we have continued to work to change this system, but we have a ways to go, the only option that you had was a yes or no into a large hospital, or no, you aren't getting care. And that only happened at the very highest end level of care. And the only determining factor was whether you were a danger to yourself or a danger to someone else. Well, that is not nearly enough. What we want to do is provide care to people when they need it. And that can range from all types of things. That can be, I have lost my job and I can't seem to stop crying. I have no motivation to get up out of bed, and I'm starting to have thoughts of harming myself. I'm not going to do it, but I'm starting to have thoughts. Well, that person, we want to provide help and care to as well. We don't want to say, oh, sorry, you don't meet the level of care to go into a hospital, so that's it. No, we want to take that opportunity when that person is reaching out to provide care and support and move them forward in a productive way, as opposed to waiting for them to get to the point that they are going to need a hospitalization. And one of the things that is so great with a comprehensive system is that once you have interacted with mobile crisis, et cetera, and perhaps you need some additional care from that, we have multiple layers of care for that person. We have urgent care centers. We don't have enough urgent care centers, but where we have them, they work beautifully. And what that does is like a 24/7 clinic. A person can walk in, they can come in by law enforcement, they can come in by family and friends, or a mobile crisis team could bring that person to the urgent care. At the urgent care, they can interact with virtually all layers of professionals, from a doctor, an advanced psychiatric nurse practitioner, case managers, therapists, and not only be out of the stressful situation that they may have been in so that they can have rest and respite, they're able to engage with any and all of these professionals, be started on whatever medication might start getting them in the right direction. Perhaps they hadn't been sleeping for days. We can ensure that you can get a good night's sleep so that you can look at things through fresh eyes the next day. We also can assess during that time for any addiction needs. And if there are addiction needs there, we can smoothly and seamlessly connect that person with whatever addiction treatment is needed. Now, what we have found is that 90% of the people who come to an urgent care center, that's the highest level of care that they're going to need. They don't need to go into a bed and stay a long period of time. By wrapping all that care around them right then and there, they are able then to move on to continued outpatient treatment and successful recovery. 90%. Now, when that is not quite enough, that person then, at the end of that period of time, they've come to the urgent care, they've interacted with folks, but more is needed, then they can move on into one of our crisis unit beds. Again, we have those throughout the state, but we need more. We would love for anybody who has a need to have an urgent care within easy reach of them, and or a crisis center bed just not much further than that, or in a combination together. What we found by crisis units, which what they do is they start to provide intensive care and treatment immediately, and they start a discharge plan that day. They are not looking at, hey, come in, you're gonna be here a month, we're gonna start slowly working on whatever issues are going on. They hit the ground running. They develop a safety plan, they start putting resources in place so that that person can successfully discharge to the community just as soon as symptoms are reduced enough to be able to function back in the community. And we find that having that layer of crisis unit, that 93% of those people do not need to go on to a hospital bed. So you have this layered system, one after the other, each a step a little bit more intense in terms of the treatment that it provides, but at each one of these opportunities, a person is able to get the level of care they need and move on to community-based care. And that happens throughout this entire layered system until only the very most ill people are needing to use a hospital bed for longer-term treatment.
Let's see if I can navigate my way out there.
Well, yesterday morning, we got a call around 5 a.m. in reference to shots fired in a mobile home.
It's not escaping now.
On Pine Road. We refer to it as Pine Road.
Top right.
Top
And
All the way up top.
deputies went to the scene where they found a mech.
There you go.
All right, so again, Carrie was giving or Commissioner Slatton Hodges was giving a really good introduction to really what an urgent care is. In Oklahoma County, I've been running the urgent care associated with OKIC, which was second or third in the nation and first in Oklahoma for the past 11 years. Our number one referral source is law enforcement. Also, hospitals refer to us. We have walk-ins, of course. But every step of the way, every part of this crisis system has the unique needs of law enforcement in mind. We know law enforcement is a valuable resource in the community. They do not need to be hung up for hours and hours on mental health issues that mental health professionals can step in and take that responsibility and get them the treatment that they need in the appropriate avenues. And so I'm very excited to just review all the steps of the crisis network and then take any questions that you might have. All right, what is 988? So 988 is a federal rollout. All states are doing 988. We've had call centers in Oklahoma, but they are NSPLs, which is short for Suicide Prevention Hotline. 988 is a step above. I wouldn't say step above, but it's just a more encompassing number than our NSPL lines were. So you can call 988 for a wide range of issues, not just you're feeling suicidal, although they are excellent taking those calls as well too. So 988, you call that just like you would call 911. You'll be connected with a care specialist, and based on the acuity of the call is like what kind of licensed clinician or behavioral health specialist that you're talking to. If you just need resources, they can transfer you to our local CCBHCs. Here in Norman, your CCBHC is Central Oklahoma, pardon me. And, but we have them all throughout the state. I don't think I heard Commissioner Slatton Hodges say we went from having one URC to having 23 URCs in a year, and then we have more coming this fiscal year. So in all parts of the state, we have URC access. This is important because when somebody calls 988, the 988 operators, like they can help get them to the appropriate resources. They can get them to a CCBHC warm line. A CCBHC, I'm sorry to speak in acronyms, but it's Certified Community Behavioral Health Center. They have their own lines. They can be transferred and get appointments and get somebody from their local CCBHC to either talk with them, provide them resources, or plan next steps. If the situation warrants, if the person is requesting an in-person response, then 988 will dispatch a mobile crisis team. We have mobile crisis teams stationed throughout the state. We have 2 here in Norman. They are 24/7 teams. The teams consist of a licensed clinician, a case manager 2, or a peer recovery support specialist. The licensed clinician is the mandatory part. The CM2 or the peer, sometimes teams have 2 peers, sometimes they have 2 CM2s. They can use any combination of that, but it's always a licensed clinician on the team.
Councilmember?
What year were these? This is the first I've ever heard about this. Like, when were they established in the Norman area?
This went live July 5th.
22?
Yes.
Okay.
Councilmember?
How many calls have you received since July 5th of last year?
I have the exact number on the presentation here, but we're averaging about 3,000 calls a month
Good gravy. Statewide?
statewide. Yeah.
How many of those calls are initiated by law enforcement?
Well, we are.
Can't response to
Yeah, yeah.
Oh, I'm sorry.
Yeah.
Yeah.
Yes, ma'am.
I was actually going to ask a similar question. Is 911 able to transfer the calls to 988? Or if a 911 dispatcher dispatches an officer, can they also contact 988 to dispatch a professional as well? Or is it typically the officer is going to go out and do the dispatch for 988? Or are you recommending that everyone in the communities call 988 versus 911?
Well, right now it's a combination of all of the above, to be honest. So we are currently working on right now. In fact, tomorrow I'm going to Broken Arrow for a 911 directors meeting to recommend the 988 transfer protocols. Currently, some calls are being transferred, but it's in its infancy, and so the number is very small. That's why we're working on these protocols of what 988 is and when it's appropriate to transfer calls to 988, and when it's appropriate for 988 to transfer calls to 911 as well. So basically the protocols will, and I think I talked about it in the presentation, I'll get to it, but basically if there's acuity associated with the call, so like there's a dangerousness associated with the call, it should always be a law enforcement response. Right? 988 is a voluntary service. It's not for people to call when they feel like someone's being a nuisance. The person that calls needs to want the team there. They need to want help. It's not, a service to like just go take care of people that somebody's deemed an issue or whatever. So sometimes the law enforcement is dispatched first, and when they get on the scene and they see that it is a mental health issue, a lot of the officers throughout the state are equipped with iPads, and those iPads have 2 buttons on them. And one button connects to a therapist, and that therapist can help either do an emergency assessment or just talk to the person and recommend services, or talk to the officer and make recommendations about what to do in this situation.
So then how many calls are we getting from our Norman police officers to 988? Do you have that further in the presentation with that statistic or that number?
I do not have Norman calls specifically. I just have like a general idea.
And do you know if Norman has the iPads?
We have talked to Norman Police. They do have iPads, and we have talked to them
How
about
long
like
have they had
implementing
them?
further. I mean, I feel like that they've had them at least a year.
No, we're working with Norman PD right now. They're piloting. We're really excited. They're piloting that iPad work. I believe right now they have 46 iPads that we've supplied them, and certainly we've been in communication, and they know that at any point in time they want more than that, or have any training needs associated with that. We're happy to partner and make those immediately available.
And those were provided when? Sorry.
Just recently, yes.
Like in the last.
We had 12 of them. We had 12 of them when the program first initiated about 2 years ago, before it was actually fully staffed and fully 24/7. So they weren't fully functional, and so they weren't rolled out to everyone then. Since July 5th, it's been getting all the bugs kinked out and worked out. So we have 12 that are in the field right now deployed as a pilot program. We've requested 95 total. We have 46 on hand. When the pilot program ends end of February, the plan is March 1st to roll them out patrol-wide, but we've requested 95.
And the pilot program began with you guys July 5th also?
We've just
Or
Yeah,
since the
everything-
2 years
yeah,
ago?
everything started with 988. Everything's grown since July 5th. And so
Okay, thank you.
Councilmember Foreman?
Mine's a short one. City Attorney Walker, would this be something that's an applicable purchase with the seizure funds that you're aware of? Something that we can spend for something like this?
I certainly think a case could be made, and I'm happy to look at that.
Okay, I'd like to.
Councilmember Shooter?
May I clarify if I may? We actually supply the iPads and we
Oh,
cover
okay.
the full cost. They are iPads that work off of a cellular AT&T FirstNet network, and so they work off of the AT&T First Responder network, and so we don't have an issue with access in rural areas, that sort of thing, and so we supply and cover the cost of this.
Favorite price?
Exactly.
Councilmember Shooter?
Yes, yeah.
Just for the record, this is Nisha Wilson. She is our Chief Clinical Strategist at the department.
Could you spell Nisha for me, please?
NISHA.
Thank you, ma'am.
Wilson.
Okay, my questions were related to the iPads as well, because I think we've been getting conflicting information that yes, NPD has iPads, no, they don't. So I think it's helpful to understand that currently we only have 12 deployed in the field as a pilot program, if I'm understanding that correctly. So is that safe to say that 12 officers have them, so they're with one person the whole time, whether they're on patrol or anything? So they're not shifting from different officers?
correct. Those 12 officers are primarily CIT officers. We try to get them to a wide array of different folks so that we can get as much positive and negative feedback as possible so that we have a solid program to roll out. Again, everything really came on board since July 5th, and so we don't want to halfway launch a program. If we're going to do it, we want it to be full and complete and as thorough as possible. So we're going to make sure it's as solid as it can be.
Okay, and so we now have 46 in total, and so when do you anticipate the rest of them being rolled out to officers?
March 1st is when we plan on rolling out all 95 to patrol. The preliminary plan is to make sure that every patrol unit has one. We plan to have one in communications in case we need one there. We plan to have some in investigations. We plan to make sure we have them available in animal welfare. And then we'll have them with supervisors as well so they can fill in any gaps. If someone doesn't have one goes down, one is broken, but we'll have a surplus of extras just in case.
Can you give us an idea, just so that like the public and us can understand, like how many officers are on patrol on each shift? So like how many potentially could be deployed at any one time during your different shifts?
It just depends on the day, but
Sure.
Usually a minimum of at least 12 officers on day shift. Afternoon shift, we have a minimum of 16 officers, usually 15 to 16. Night shift usually has a minimum of 10 to 12. So at any one time, but those shifts do overlap at times, and so you could have as few as 10 to 12, or you may have as many as 20. During our busiest times of the day, we may have 20 officers that have them available. But during our pilot program, we've only used them a few times so far, and that said, they're like Ron mentioned, people have to be willing and able to talk and want to communicate with someone. The iPad is not really effective if someone doesn't want that communication. So it's really if someone's willing and able.
Sure. I have some more questions, I guess, related to the criteria of like law enforcement being able to kind of initiate a 988 call, or as I want to understand if that criteria is different than the criteria to place someone in kind of mental health custody and to get them a bed. And are those two things different? Are they the same? I don't know if you're going to go over that in your presentation, but I do have some
Sure, we
questions
have a
related to
lot
that.
of iPad data and a lot of stuff that I think could answer a lot of these questions. So we are here to answer any questions that you have for sure.
Okay, well, I'll let the presentation go, and then if I've got specific questions related to that, I'll jump back in.
Sure.
Thank you.
Councilmember Grant?
How many of those 988 calls are in Norman, like roughly?
I think that the better number is how many dispatches, mobile crisis dispatches that Norman has had, and that's been around 40.
Since July 5th.
Yeah.
And then I heard there's 2 buttons on that iPad. One connects to a therapist. What does the other button do?
The other one is for police officers. If they're having their own issues and they want to talk to a therapist, it's for them to be connected. It's different because we would want the therapist to not be really in their area so that they wouldn't be working with them or whatever. So But those are the only two buttons on the iPads.
And then, maybe this is for our MPD. How many are CIT trained right now?
So we have, right now, we have about 18% of the PD that are CIT trained. We were up to about 23 or 24% a couple of years ago. With our attrition that's occurred in the last couple of years, we're down to 18%. CIT International recommends 20 to 25% of your police force to be CIT trained.
Is there any segment of MPD that everybody is CIT trained that's on there, like SWAT?
Supervisors are also CIT
Supervisors.
trained, and communications are, all of our dispatchers are CIT trained. And so we have at least 2 trainings that we send folks to every year. Our academy is also, we've gone through the debate about having our academy be CIT trained also. CIT training is a higher level of training, so you want people to have at least 2 to 3 years of mental health, of actual law enforcement field training before they go to CIT. That's important, so that they actually have a background to reference. So what we did is that we built in a 40-hour mental health training well above and beyond what CLEAT requires of our officers. So our officers go through 40 hours of mental health training that's complementary to CIT, so that if they want to be CIT subsequently, they can go to CIT school and they'll get an additional 40 hours of mental health training. So for the past 2 years, all of our trainees have received 80 hours of mental health training if they become a CIT.
How many patrol officers, given the 3 shifts that I heard earlier, roughly is 1 or 2 of them a CIT trained officer?
It just depends on the shift and the makeup. It's not, I can't give you an exact number on that, I'm sorry. I wish I could back anything.
Thank you.
Councilmember Foreman?
My question was, are there going to be officers with the iPads that aren't CIT trained?
There are 2 officers that during the pilot that are not CIT trained, and that was intentional because I wanted to make sure that even if someone's not a CIT officer, that's something that they can deploy, and I want to get their feedback as well. And so there are 2 out of the 12 that are not.
Okay.
Councilmember Sadly?
And perhaps you'll get into this further into the presentation, but we're talking a lot about iPads. Is that the only way to deploy a professional out to a scene is through an iPad? Or, because I know we're talking a lot, well, if the person doesn't want the professional help, but if you're in a mental health crisis, oftentimes you're not even able to relay that information. And so maybe you don't want to sit and look at an iPad, but perhaps if someone were actually out on site and could have a face-to-face conversation, that would be different. So outside of the iPad, what other ways do we deploy these professionals?
Well, oftentimes the person calling 988 is the person in crisis, but not all the times, because sometimes it's a family member or a friend. And 988 is not going to dispatch a mobile team to a person who's absolutely saying that they do not want an in-person response, but they will dispatch a mobile crisis team to a family or friend that's having difficulty dealing with a situation. And so the mobile team will be present. And then if acuity dictates, then that's when law enforcement needs to be called in. But oftentimes, the mobile crisis team's specialty is community stabilization. So they're experts at trying to get a situation calmed down and to get that person.
So if it isn't a family member, if it is an officer that's out there recognizing that there is a mental health crisis and the person isn't wanting to talk to a professional, can they say, I need someone out here to help me because I'm not getting through to this person? They haven't committed a crime. They're in a mental health crisis.
Law enforcement for sure can call 988 and coordinate a team to come out and respond with them. Now, I've heard some in Oklahoma, there's one of our CCBHCs has a grant, and they have a team that they call the Champions Grant. And they work very closely with law enforcement of more of a co-responder model, as well as their 988 response. And from what I've heard, it's been very successful. So that's a pretty interesting situation as well.
That's awesome. Thank you.
Yeah, again, like this launched in July 5th. We're learning and growing every day. And we expect that the way that it looks next year will be leaps and bounds over what it is right now. But what it is right now is pretty incredible. So a little bit of numbers, 16,000 calls so far, text, chat, 850 mobile team responses throughout the state. And nationally, we are ranked 6th in our responses, in our crisis network response. And we're 1 second away from being 4th. So we're doing a really great job with our 988 launch. So
Thank you
we're
for
really
that.
excited about that. All right, so this is just kind of how we were talking. Somebody calls 988. They're talking to a community support specialist, a care specialist. If that person needs local resources more so than 988, they can be transferred to a warm line that the CCBHCs have. If there is a need for a higher level of intervention, they will work to get a mobile crisis team to that person. For those that have a mobile team dispatched to them, then there's a follow-up requirement within 24 hours, 48 hours for that team to follow up with the person. If a mobile team is not dispatched to that person, Solari, who is our contracted provider of 988 call center services, will follow up within 24 to 48 hours. Okay, kind of as we were talking about mobile crisis team and how Commissioner Slatton Hodges was describing it, the goal is to keep people in the community that they live in and that their family members or their friends are. It's really stressful for someone to be yanked out of their community into a hospital, 2 or 3 hours away. Friends and family members struggle with going to visit them. It's just very unfamiliar to them. So mobile crisis teams and urgent recovery centers were created to help keep people in the community that they exist in. And just like Commissioner Slatton Hodges was saying, not everybody needs to go into an urgent care. Not everyone needs inpatient hospitalization. Just because you're having a moment or you're having a crisis, if you're talking to the right people who are professional in like de-escalation and resources, those situations can overwhelmingly be stabilized in the community.
That's wonderful.
Can we just get a little bit of clarification on the urgent care level? Because when most people hear urgent care, it's like I'm going down because I have a cough.
It's
cold.
medical, yeah.
So, what is the difference between like what the way the public knows about urgent care and how is this different?
That is an excellent question. And forgive me, like I could talk about this like all day long. So if I get a little mental healthy on you, please just say enough. But so 43A is our mental health statute in Oklahoma. As per 43A, somebody meets ED criteria when they are a danger to their self or others due to a mental health issue or a substance abuse issue, or that they are unable to care for themselves due to that mental health or substance abuse issue. An urgent recovery center in the mental health realm is a stabilization period. So somebody's having a crisis, law enforcement intervenes or mobile crisis team intervenes. That person's willing to go in and talk to somebody. Like they can be brought to an urgent recovery center. They talk to a therapist. They have a nurse. They have a psychiatrist on board if necessary. And the whole goal is to step that person off the crisis, which like Commissioner said, 90% of the people who come into urgent care, that's the highest level of care that they need. By the time they leave the urgent care, they have an outpatient appointment. Oftentimes they've met with outpatient liaisons. They know exactly what they're being offered. They have an appointment time. Sometimes they're walked over or driven over right at discharge to be given services right then. Another part of the urgent recovery process, though, is that 10% that are not able to be stabilized. Because let's face it, like we have some challenging issues. We have a lot of methamphetamine in Oklahoma. So a lot of alcohol, lots of drugs, become an issue, and sometimes that creates very challenging situations on top of mental health. Already established mental health issues. So when you're dealing with co-occurring issues, it's going to take longer than a day or two. And so oftentimes those people suffering with those issues might need to go into a crisis bed. They're meeting emergency detention status or the definition of emergency detention. Once somebody is meeting that criteria, we can hold somebody for 120 hours, not including weekends or holidays. They meet with a psychiatrist and a treatment team, hopefully including any family members that are willing to come and participate in that treatment, or friends and family that consumer deems appropriate that they want involved in their treatment. So then we work very hard to stabilize them at that level. And then if they can't stabilize at that level, then we might have to go a step further and consider psychiatric hospitalization. So every level of crisis is to try to keep people stabilized at the lowest level of care possible and not go on and like reserve like hospitalization for those most in need, you know. And it's pretty successful. Yeah. Or I'm sorry. I didn't mean-
You're Councilmember.
I guess like a little more specific, like Integris has like urgent cares everywhere. Like you're not going to Integris. Are you going to Integris or are you going to like a very specific urgent care?
Well, so in urgent care.
They know, is it a surprise?
Urgent care is kind of a generic term.
Yeah,
you know,
right.
so like and when you think of Integris urgent care, you're going for medical issues,
Right.
not necessarily mental health
But there are
issues.
specific sites that you're like intentionally going to.
You mean for specific medical issues?
Brick and mortar is, I think, what she's asking.
Where are the URCs at? We have specific URCs,
Yeah,
crisis
that's,
centers.
okay.
I see, yeah.
Yeah.
And you have an urgent recovery center here in Norman. It's operated by Red Rock, and it's on the grounds of Griffin Memorial.
Okay.
Oh.
Into crisis.
In the crisis unit, yes.
I was like, is Mercy going to be surprised if like Captain shows up? With, like,
No, Mercy sends people to us all the time.
Okay.
Integris sends people to us all the time. Saint sends people to us all the time. Hospitals are very familiar with our processes.
Okay.
Councilmember Sutton.
All right.
Okay, so
Yeah.
you had mentioned that Norman had 2 centers here, and one is Red Rock. I'm assuming the other is Griffin.
Two urgent recovery centers.
What all does Norman have? Let me just ask that.
That is probably a good
That's
question.
a better question.
All right, so you have Central Oklahoma.
Okay.
You have CRC, which is Children's Recovery Center. You have Griffin Memorial. And you have Red Rock, which has an urgent recovery center and a crisis unit.
So the portion that you mentioned about where they could stay for 120 hours, that's called Crisis Stabilization Center, is
Yeah, I'm sorry. These are all like internal technical terms. So urgent recovery is the stabilization unit.
Okay.
And then a crisis bed is once a person is meeting emergency detention criteria, then they get into a crisis bed.
so that
And
initial.
that's the 120 hours.
Okay, so
Yeah.
that initial urgent care, whatever, where they're coming in, there is where you can hold that person for up to 120 hours.
No, that urgent recovery center is a voluntary situation until it's not. So
Okay.
everyone is voluntary until they are assessed by a clinician. And once they're assessed by that clinician, the clinician makes a determination whether they're meeting ED criteria or not. Usually the average URC stay is under 24 hours.
So how, are there, because since you can only hold someone for 120 hours, have there been times where there's not beds available, where we've just had to let people go back?
No, there is a court commit process. And so then we would file documents with the court, and then they would go before a judge. The judge would make the best determination, and then we would hold that person until a bed was available.
Okay, thank you.
All right, so Solari, again, who is our 988 contracted provider for 988 call center services, they have a public-facing dashboard with a lot of information that you might find really interesting. This is just kind of a snapshot of it, but you can find the dashboard on the department's website at odmhsas.org, or you can find it on Solari's website, which I believe is solari.org. Yeah, okay. SolariInc.org.
Councilmember Lynn?
Is that all of Oklahoma? Or
Yes, sir.
What Do you have it localized, any data to what might be in our area right here?
We have calls in the area and we have dispatches.
Do you know how many calls in our area in that same period of time? Just in comparison, how much of that chunk are we making up?
Cleveland County is our third busiest county. So it's Oklahoma County, it's Tulsa County, and then Cleveland County. Now that being said, like your call volume is not super high. I think that you guys are just now learning about this system and learning how to engage with it. So I expected more calls and more mobile team dispatches to come now now that like we're talking about it more. So like I said earlier, you've had about 40 mobile crisis team dispatches. And I think I have the numbers here in the presentation. If not, I have them in my bag, so I'll get you the answer to that.
Hey, thank you.
Ron, can you go back one? There's
Yeah.
one thing I want to mention.
Sure.
So one thing I want to highlight on the dashboard you can see is the average speed of answer. So what this dashboard shows is in the last 30 days, there were over 3,400 Oklahomans that called 988. Those calls were answered an average of 11 seconds answer speed. And the other point in the top right-hand corner is also really important, that 92%. What that shows is that those trained individuals that are answering the phone when someone calls 988, 92% of the time are able to address that need over the phone, and that person agrees that they need no further intervention or no higher level intervention at that point in time, and instead maybe want to get connected with their community resources so that they know how to address ongoing concerns that they may have. So I do think it's pretty impressive, and it's something that we in Oklahoma should be incredibly proud of, is our 988 rollout, with as many people taking advantage of such a new program and our success in that. And so when you think about the individuals that are in need of a mobile crisis dispatch, that's well less than 10% of the total people that are calling 988. And so what Ron is talking about is our goal is to have those evidence-based interventions with highly trained professionals at every point in that crisis continuum, so that someone calling 988 the majority of the time needs no further intervention. Someone who needs a mobile crisis dispatch the majority of the time needs no further intervention. And so that's our goal, what Ron is talking about, but our data I think is pretty incredible around that. So I wanted to highlight that.
So in the beginning, and I think this is what Councilmember Studley was alluding to, what you had said. You said there's 2 crisis response units in Norman. Where are they housed?
So Central Oklahoma has a team. We also have a contracted provider, CBI, that is housed in Oklahoma City, but will do dispatch here as well. And then we also have a adolescent specialty mobile crisis team, and that's housed at Children's Recovery Center.
Please.
All right. Transportation. Transportation is an interesting topic in Oklahoma. Like recently we had a statute change. We used to lean on law enforcement really heavy for law enforcement transports. And we appreciate all the work that you guys have done around that. Today is a new day. We have a private contractor that does a fantastic job, but we do thousands of transportations. This becomes important also when you're talking about community response. When you respond to the community to a crisis, the mobile crisis teams are really experts at stabilizing that in the community. But let's just be honest, there are going to be some times when the illness and the crisis situation is going to require further treatment. And so the mobile crisis teams, they can do the emergency assessment in the community. And then if that person is willing to go, then the mobile crisis teams can transport to the nearest URC. But if the person is unwilling to go, Then we have rideshare, and rideshare is trained to deal with difficult transportation situations. And so we're really lucky to be working with them, and it's been really successful. Now, law enforcement still does transports when it's a co-responder situation, for sure. Law enforcement still has a role in that. But if it's just a mobile crisis team and law enforcement is not involved in that, we do not have to call law enforcement just to do the transportation anymore. And that's a pretty great thing, so.
What's the usual response time? And if you have to transport, how long does it take you to mobilize, get the person and bring them up?
That is an excellent question. As per contract, in urban areas, all teams have to respond within an hour.
Okay.
Now, of course, you know, Oklahoma, there is a lot of rural areas, and sometimes it's going to take a little bit longer than an hour. So in rural areas, we extend that to 2 hours. But again, like as the system grows, we will constantly be reevaluating those needs. We constantly evaluate mobile crisis response times and the amount of times they're being deployed. And so we will be adjusting accordingly.
If PD is with a person during that time, and it takes an hour to get from the city, are you talking about the whole turnaround, or does it take an hour to be on site, I guess? If they're trying to not detain, but to keep somebody's in care, in conversation, and everything else for an hour, that sounds like a long time to me. It may not be.
It can be. You are correct. That's why it's important that we implement these iPads with law enforcement, and so they don't necessarily have to wait for the mobile crisis teams. And I'll tell you, a lot of our law enforcement personnel, our law force in the state, are familiar with the urgent recovery centers, and so sometimes they'll just drive them there anyway. I mean, that's what happens at OKIC a lot.
Okay.
So.
That makes sense. Thank you, sir.
Yeah, I'm with you. Like, if I was law enforcement, I would not want to be waiting around an hour for a mobile crisis team. But I just want to clarify this also. It's not like 988 is hanging up the phone and just be like, oh, they'll get there. You know, it's not like ordering pizza. If like the 988 is on the phone with the person until the mobile crisis team gets there, and if at any point they get concerned about the acuity level of the call, then they will wrap law enforcement in on that call as well. And our teams are so dedicated. I just have to throw this out there. Like, we have CCBHC partners with Grand Lake and Green Country, and they're oftentimes like driving down dark dirt country roads, like trying to find places that aren't on GPS, and they'll be calling, you know, like these are dedicated professionals. It's really awesome to work with them. All right, this is kind of going back and talking about urgent recovery centers and crisis centers. Again, our urgent recovery centers are 18 and plus, 18 years old and older. And again, it's about working with a multidisciplinary team of professionals in order to stabilize the crisis at the lowest level and either wrap that person up with community-based services on discharge, or get them to the next level of care, whatever is needed. And that's been a phenomenal change in Oklahoma, very successful. Proud of the little role that I have played in that program. Very excited that Oklahoma has expanded that program. All right, this is talking about a little bit of the tablets, giving it a little bit of numbers now. So 24,000 tablets dispersed around first responders. Nisha, why don't you talk about this a little bit?
I'll be happy to. I think one important point to take away with the iPads is that this is a way of doing business now in the behavioral health field. And so while, yes, we do have iPads that are dedicated for law enforcement use, it's also become a really important tool for providing basic behavioral health services in the state of Oklahoma also. We have many consumers out there that we serve across the state that are issued these iPads and actually receive their primary behavioral health services through telehealth services through that iPad. And so they're able to connect with any member of their treatment team. And it just makes behavioral health care so much more accessible for individuals that may have barriers to actually getting into a clinic. But it also just really makes behavioral health providers much more accessible in times of crisis as well, because they know the provider that they have an established relationship is one button away, and they can see that individual face to face for a session. And so it's really become a model of service in Oklahoma. Again, something to be incredibly proud of as a state, because as a state, we are absolutely leaders in the expansion of the access to telehealth services, which is so important in a state with so many rural and frontier areas, but also to so many people in need of behavioral health services. And so we do have about 24,000 iPads dispersed across the state. That includes those law enforcement iPads. It also includes the iPads that are directly provided to consumers. The way that those work is that it is a direct lockdown, HIPAA compliant connection to a behavioral health provider that has an iPad on the other end. And so those iPads are locked down. They can't be used for anything else outside of those purposes. The iPads that we provide to law enforcement do have two options. Really, when you open up an iPad, you would see two buttons. That one of those buttons is for individuals when a law enforcement officer is interacting with an individual in crisis in the community. And so that's going to connect with their local behavioral health provider so that they can talk about the situation. That officer can receive a consultation around a particular situation or crisis that's happening. Or many times we hear from officers that they like to just be able to hand that iPad over to the individual in crisis. And that crisis can be resolved through that direct connection through the iPad. They can de-escalate services, provide de-escalation services through telehealth, even make outpatient appointments for that person. And so we hear statewide from officers how tremendously helpful that is, because that process is much like having a behavioral health professional riding in the car along with you 24/7 that can be accessed as soon as needed. The other button that we added a couple of years ago was a connection for officers to receive their own mental health services or debrief. We know that many law enforcement agencies have established their own peer support programs and their own employee assistance programs, but there still exists so much stigma for officers and first responders to access behavioral health services for themselves. And so we wanted an anonymous avenue for officers to be able to access behavioral health care for themselves as well. We hear from officers that that can be especially helpful when they have responded to a traumatic call or have had a particularly challenging week, for example. We want our officers to be able to have an outlet to access care as well. The important distinction between those two buttons is that when that officer selects the button to receive help themselves, we want that button directed to a provider in a different part of the state. And that really helps protect anonymity. We don't want that officer to feel uncomfortable pushing the button to access their own help and their own services and see a person that they may see in town and know personally. And so really trying to help protect that anonymity. The data on here I think is pretty incredible. Since April 1st, we've delivered services on around 46,000 calls across the state of Oklahoma. As I mentioned, this is a primary way that many people across our state now receive their behavioral health services, and it will do nothing but continue to expand across the state.
Thank you, Nisha. Go ahead.
Is this something that they can use in jail facilities? So if you need to have a mental health evaluation on somebody that's currently being housed in a jail, is that something that you guys offer?
So that's not traditionally done through the iPads. We do have several partnerships with county jails to come in and provide services in some situations.
Like the mobile crisis units or
Mobile
whatever
crisis
go
does
out?
not right now respond to county jails, but certainly, the other important connection too is your local community provider, because even though any member of the public can call 988, any member of the public can also call your local behavioral health provider. provider. And those mobile crisis responses are available as well, calling, for example, here in Norman, Central Oklahoma directly and requesting a mobile crisis team. So many times in the criminal justice system right now, those partnerships are formed by the local community mental health centers. And so instead of calling a number like 988, which is a statewide number, they would call their local mental health provider to have a conversation about a particular need.
So does your department or unit function with working with like Cleveland County Detention Center, for example?
We do work with Cleveland County. Yes, we absolutely do. Now, we are not the primary behavioral health care providers in any of the county jails. The county jails provide those services to the individuals that are in custody in those settings, but we do provide partnerships through different work like screening programs and things like that inside county jails.
And when they call you guys, how long does it normally take for you guys to arrive to do those types of assessments?
It probably really depends on the situation. Duran, do you have an idea on what that might look like?
And just to say that, as Nisha mentioned, the county jail is responsible for providing mental health treatment, all medical treatment, including mental health treatment. So I know like Cleveland County contracts with Turnkey, an organization that provides mental health treatment and all medical treatment in most county jails. So they are the primary care giver in county jails. What we do sometimes is if they have somebody they feel like is somebody they cannot deal with, we can provide what we call jail stabilization or diversion. Those programs require a couple of things. One, it requires cooperation with the district attorney's office. So if they want to do a diversion, we ask that they dismiss the criminal charges, particularly if it's a low-level misdemeanor or nonviolent crime. If they dismiss the charges, bring those individuals to Griffin, we will assess them, and if the person meets inpatient criteria, we will provide the treatment. Sometimes they're not willing to dismiss the charges. In those situations, because state statute requires that we cannot take someone from jail unless they are out on bail, then we ask the cooperation for the district attorney's office and the courts to release the individual. Then we will take that individual to an assessment. If they meet inpatient criteria, we will provide treatment.
So just to understand what you're saying, once they get into the jail system, it's really going to be up to a judge or the district attorney's office to determine whether or not the person is going to continue to be pressed with whatever charges they had to get in there. And then if they're not pressed with charges, then you guys can provide an assessment or take them out and provide additional mental health.
That's true. But while in jail, it's our understanding that the mental health provider, Turnkey, provides treatment for the jail. I have no reason to believe that that treatment is inadequate, so I'm assuming that they're providing good treatment. We do have a relationship with that provider in some counties, not currently in Cleveland County, where we have done some collaboration. For example, in Oklahoma County, we do work with Turnkey to help assess individuals that they find more difficult. But again, if they're going to come out of the jail, it's going to require either the charges be dismissed or the individual be released on bail.
For council's saying we've got about 20 minutes that we can keep on going, and so if we can stay right what City of Norman can do, we'd sure appreciate that.
Right. The city of
Councilmember
Norman
Fulton.
could definitely prevent arresting people and taking them if they're not committing crimes.
Well, this
Councilmember
marks
Fulton.
kind of the end of the formal PowerPoint presentation. I just wanted to say, I checked the data. Cleveland County's averaging about 58 calls per month. So again, like not a tremendous amount of calls, but still third highest in the state. I appreciate your question. And again, under the circumstances, I think it's very appropriate to be asking, what exactly can we do different, right? And so I hope that the future talks are more about how we can integrate this crisis system and work together with the city of Norman to provide outstanding outcomes and to prevent things that like what happened, keep that from happening.
Agreed. Councilmember Foreman?
So I don't think we want future talks. I think we want to talk about this now. You've given a great presentation. A lot of this stuff I was not even aware of happening within our own city, and I'm a council member here, so that's concerning that I didn't know these things. But we have a council that wants to help aid. What can the city, off the top of your head, what can we do to help aid and assist with this and get the ball rolling now? Because the time's ticking on our pot of money. So what can we do? What could you imagine us partnering, something, anything?
Well, Duran, do you have any suggestions?
I think if we continue to move forward, particularly with the integration of iPads, I think that is a huge move. As the police department continues with their pilot program, becomes more and more comfortable, we would like to be able to provide an iPad free to the city to every law enforcement officer. I think that gives the law enforcement officer the opportunity to immediately connect with a licensed mental health professional, as Ron has explained. I think that it does a lot to alleviate situations as they arrive, because there's a whole spectrum of mental illness. And so in most cases, I think as the data shows, they're able to calm and get in a situation under control. It also helps the officer, if the officer is trying to make a determination of whether to bring the individual to a crisis center, whether the person meets criteria. Officers do have that discretion now, but I think it would make officers feel a little more comfortable if they had a licensed mental health professional on the iPad assessing the individual, to help them make that decision, because then the assessment's done. When they come to the crisis center, an assessment's already been made, it makes that handoff a lot easier.
I'd also like to see a little bit more awareness and like things that like promote awareness. Now, the department has been engaging in, we have billboards up, but now that we've talked about it, you'll probably start seeing it all the time. We have a billboard up by Warren Theater that's always talking about 988. We have television spots, but still that type of engagement isn't necessarily like boots on the ground, community awareness type of stuff. So the more that we can raise awareness of the system, the more that people know that they can call 988 and like have services. We want to help people before it gets to the point where they need a mobile crisis team or to go to an urgent recovery center. We want to help people right when the issues are starting. So anything to help raise awareness, I think we'd be really open to.
Councilmember Holman?
Yes, thank you. I appreciate the presentation and the information. I found it very helpful, finding out some things I wasn't aware of, specifically about how this is working, given that it's only really been 6 months or so. And that's kind of what we've been waiting for, because, you know, City of Norman, we were talking about maybe creating something like this before 988. And then we were told 988's coming online next year. Let's hold off and see what happens here. And now that we're 6 months into it and we have a better idea, I think that is kind of what we're thinking is it's a statewide service. We assume there might be local gaps that it doesn't fill. And if there were, would that be where the City of Norman could step in or would be needed to step in to fill in any gaps that the statewide service is providing? Is what I'm understanding from your presentation is that they're, even though it's a statewide service, that there's a lot of it that is centralized in Norman actually, and so maybe the gaps that we need to fill locally are bringing more awareness to our community that this service exists, so folks know that this is an option. Because I agree, if people don't know or they've been used to calling 911 for everything forever, and they don't know about this or they're not sure about it. So maybe that could be part of our role, from your perspective, is using our resources to educate and promote to our citizens that this is here, and a good amount of it's based in Norman. Because that again is filling in wherever this may not be addressing issues. And with the incidents that we've experienced, it gives us the impression that there may be gaps that aren't being filled when this happens twice in the same month, you know. So that's kind of what I'm looking for as well, is whatever the City of Norman can do to supplement, to fill in, to help promote, whatever it is, that's what kind of I'm here for. And so I really appreciate the information. I'm very much looking forward to seeing how this continues to kind of, as more people become aware with these services, how it works and how our police department is implementing it, how this pilot program works out. And I'm very interested in CIT training for our officers going forward with more than 18%, sure. I know there's lots of factors that make that difficult, perhaps, but I think that's a really good goal for us to be pushing for is getting. I mean, ideally, all of our officers.
We agree. 100% CIT. I agree too.
Thank you.
Councilmember Grant.
Thanks for the presentation. I actually talked to city manager earlier about Porter Campus, and I don't know if somebody from Norman Regional came.
We do have the doctor in charge of the behavioral health program for Norman Regional with us here in the back, and I contacted Mr. Split when the request for this particular program came up. In my initial phone call with Mr. Crosby and Mr. Dismukes, the thought of a local enhancement to services available. How can we take full advantage of service providers already in Norman? And obviously we have a relationship with Norman Regional Healthcare System because it's a trust of the city of Norman. So really appreciate, Doctor, your visit with us and you're hearing what's going on. If there are opportunities for us to work more closely with Norman Regional to enhance services available in Norman, we would love to hear from you.
Also, and I mentioned that because we talked about Turnkey, and Turnkey has been sued. Cleveland County in 2014, Turnkey settled 2 lawsuits. One was from an October 2011 incident and one from a 2009. Both were people who were not treated. That's why they settled a lawsuit. Then we have Marconia Kessie. He also probably saw Turnkey during that time. And I've heard from many people since this has happened that people are not receiving their medication in jail. So I'm curious how an alternative option to Turnkey, maybe through Norman Regional, might address some of those health issues. Like, what do you see in a 50-patient bed if somebody has to come to you?
Okay, so can you please ask the question again so I can understand the answer?
What kind of care do you plan to provide to people if they come to you instead of going to jail?
Oh, okay. So I will tell you how the process works at Norman Regional. Anytime anyone who's in a crisis situation, they are brought in either by the police or the family members or the EMS to our ER. When they come in the ER, they are evaluated by the medical doctors. They go through a complete medical screening, during which we do physical examinations, review of symptoms, labs. We make sure that the patients are medically stable. Once they're medically stable, during that period of time, they're also assessed for safety with regards to their mental health crisis. At that point, it is a determination is made whether they need to be admitted to an inpatient psychiatric facility or not. If that is the case, and I will elaborate on the time period of 120 hours that we were talking about. So if somebody in a crisis situation, anyone, a police officer can fill out a peace officer statement, or you or I, anybody can do a third-party statement. With that statement, a patient can be kept in a ER or in a facility for 12 hours where they are evaluated. And then within those 12 hours, they have to be evaluated by a mental health provider, a medical doctor, a medical nurse practitioner, psychiatric nurse practitioner, medical PA, psychiatric PA, who can further determine whether they meet criteria to be admitted to an inpatient psychiatric facility. To be admitted to an inpatient psychiatric facility, someone has to have a crisis situation where they are suicidal, homicidal, unable to take care of themselves, under influence of drugs, so mentally incapable of caring for themselves or a danger to themselves or others. At that point of time, the physician can do a document called a licensed mental health professional statement. Once that document is done, now the patient can be kept against their will in a psychiatric facility for 5 days, which is 120 hours. So at that, this is all being done in our ER. So we make sure that everything is covered. At that point, we make a determination to admit the patient. Often it happens many times, several times, and I'm very proud of the fact that we are the only hospital where we have a full-time consultation service. When these patients come in, they are not medically suitable to go to a psychiatric facility. So we admit them to our medical floors, we place a sitter with them so that they can ensure their safety on the medical beds, and then we are called for consults because I have a full-time consultation service. We see them on the medical floors. If we determine that they're medically stable and they can go to a psychiatric floor, then they come to our behavior medicine unit, which is a 20-bed unit. Once they get admitted, they are evaluated in the beginning by our mental health techs, then the nursing staff, and then the physician. During that period of time, we do a complete psychiatric evaluation and determine what kind of medication do they need depending upon what diagnosis they have. And at that time, we have some kind of an idea of how much time would this patient need to stay here. Once we do that, next they are seen by social worker case managers who determine what kind of counseling they will need and what kind of resources they will need. Then throughout the days, we have individual counseling, group counseling, activity therapies, craft therapies, meditation therapies, pet therapies, yoga therapies, sports therapies. It's like a program that they attend while they're being seen by psychiatrists and the counselors. And then within those 5 days that we have, if the patient is better in 2 or 3 days, we know that they are stable, we can discharge them home with family. If we feel that they need to be kept beyond 5 days, we give them an opportunity. They can sign a document called voluntary admission form, which means that they want to stay with their own choice, because we want them to have that choice if they're good enough. And if they sign that, they can stay beyond those 5 days with their own choice. However, if I evaluate a patient on day 5, I don't think they're safe to go home, but they want to, then I would submit that paperwork to the mental health court. Judge Napoli used to be our mental health court judge, who was beyond amazing. So she is retired now. We have Judge Childress, and she has been very nice and kind to us as well. We submit the document to her, to their office. They review the documents pretty quickly. Then they send a lawyer, assign it to the patient, so that they can hear their part of the situation, and then they go back and report to the judge. And the judge comes and sees the patient and calls them or talks to them and decide if this patient needs to be discharged or not. So, and then at that point, they take our consult as well if we feel they're safe to go home or not. And so that is if the patient is not willing to stay voluntarily. If they're staying voluntarily, then that's pretty simple. But, so that's the legal process. During this period of time when the patient gets better and they're ready for discharge, we set them up with a psychiatrist, psychologist. If they have substance abuse needs, we determine if they need to go to outpatient substance abuse counseling or do they need to go to an inpatient rehabilitation center. So depending upon that need, we send them over there. Sometimes they need just outpatient, simple outpatient. We follow up with an outpatient psychiatrist. We do that. Depending upon their benefits, some can go to Central Oklahoma Community Mental Health, and some can go to their preferred providers through their insurances. That is done, and then we give them 30 days of medicines and make sure they have an appointment within 30 days, and then they are discharged. So that is the whole protocol that we follow. So it's pretty comprehensive. As far as 988 is concerned, I could not be more happy about this, because this was desperately needed in Oklahoma. Right now, what I'm familiar with is in Norman, we have at least 2 LPCs, licensed social workers, who respond to the 988 calls, and then they make a determination about the severity of the situation of the patient and intervene and help them placed in facilities if they need or not.
Excellent. We've got 5 minutes. Councilman Schuler?
Yes. So the question that I was kind of alluding to earlier, and we've heard a lot about meets criteria. And so you talked about that in terms of, I guess, admitting someone into a crisis bed, which, as I understand it, is, from the law enforcement side, they have probable cause to believe that they are a threat to themselves or a threat to others. Or there was this conversation, too, that I've had with some of the officers that they have a reasonable, sense that they might commit an act of violence against themselves or somebody else. But I think my question is, I understand that criteria. But what I am trying to understand is, is there another set of criteria that has to be, like a threshold that has to be met for the iPad to be deployed to, in a mental crisis potential situation? Like, they don't meet criteria to be admitted, but can law enforcement use that iPad at their discretion? It doesn't have to meet that high threshold.
So I think that there's an officer response to that, but I just want to clarify. Okay. So there is there's criteria for custody that law enforcement uses to detain anyone into custody. Emergency detention is not done by law enforcement officers, it's done by licensed clinicians and doctors, right? So I just wanted to clarify that, but then if you wanted to speak to the
So emergency detention, and we've heard that term a few times, is a process, and I'm trying to be mindful of your time, so let's talk quick. Emergency detention is a process, and law enforcement's role in emergency detention is protective custody.
Right.
Just like if there's a child that needs protective custody, we are there to act as a parent for that child. And essentially, if someone's in safety care for themselves, law enforcement steps in and acts as a parent for that person. So same regard there. So we start the emergency detention process by placing them into protective custody, and it's still based upon Title 43A, Section 1-103, Section 13, specifically a person requiring treatment. And a person requiring treatment speaks of if a person's an imminent threat or an actual threat to themselves or others, gives some different criteria, excludes a couple of different things, but specifically if a person is a person requiring treatment is what we're looking for. The same criteria that a clinician will use is the same criteria that's written in state law that we use also, but they have different tricks and they're better trained at those kind of things to make that determination. So that criteria is one thing. If we're using an iPad, calling 988 to a scene, that means that we clearly don't have that criteria. And so that is a lower threshold. And it's also one of the reasons why some of the calls aren't as high in Cleveland County is because we do have 5 facilities for people to go to and have resources for. The iPad program started in rural Oklahoma and has come to the urban areas because it was so successful in the rural areas where they needed those resources. We have so many here, and so it's come to us more recently. But the criteria is a little bit less to use an iPad, but again, you have to have someone who's cooperative and willing and able to have that communication and wants to have that communication.
Okay, I really appreciate the clarification because I think that some of that language is getting kind of messed up in like what are we able to do in certain situations, and just really being able to understand that 988 can be deployed in a much easier fashion than meeting that ultimate criteria to take someone into protective custody.
Well, 988 is the number that people call.
The mobile crisis response. Let me clarify. Being able to, and I'm using 988 too because that's the program that I understand that is being used to deploy the iPads. And they're separate. Okay.
iPads are with law enforcement officers.
Well, I understand they're with law enforcement, but it's with, sorry?
It's mobile response, not 988.
Okay, so they're separate. Okay, I think that, so back to what Councilmember Holman was saying, like, there really does need to be kind of a broader awareness campaign of how are these services different, what does 988 encompass, what does a mobile crisis response encompass, because I think people are conflating, we are, at this level, conflating those two as the same program, but they are not. So I know we're running up against time, but I think that obviously we need to continue having this conversation, and as many other council members have said, that we want to fill those gaps. We want to understand what Norman can do to continue to bring this program online, not only for our community, but kind of be a leader for the rest of the
I
state
would
as we're
agree, and
thinking about
perhaps
this.
it'd be a time not to do it where we have a time
constraint.
restriction. And we have a study session time that it doesn't have an end. And so it would be easier to do it. It's, I know you've got a
This is
question.
a real short one.
Real short one, please.
It is a short one, I swear. So city staff, this is all for naught if they don't push the button. What's the policy on when they push the button? Do we have one ready to go for all the staff?
As Ron mentioned, they're working on a state system for 988. Locally, we are developing and have a rough draft right now that we're going through on transfers to 988. So when it comes in, we can avoid an officer even responding if it is something we can transfer to them. And he also mentioned like a warm transfer where we may be there, decide if it needs to be a co-response or just they can take it over. So we're avoiding us even being on the scene to start with.
Sure.
We will also develop, as Carl had mentioned, that with the iPads, as we're rolling them out, then we'll see what type of policy we want to implement on those and make adjustments to just our policy overall to better fine tune them to work better for us, to avoid things. But the bottom line is there is going to be some people that end up in a jail system. And
But will we have a policy in place before March 1st when they all deploy?
we could have a policy in place before March 1st for 988.
That's interesting. Okay.
And we are thrilled Judge Botwin joined us this evening. He was here just minutes ago, but we really appreciate his presence. This is on YouTube. All of this information is not lost. It will be recorded and shared. And I'm feeling an opportunity maybe for some podcasts specifically focused on these areas with questions that came up this evening and direct responses that we can do with our behavioral health professionals.
It's fascinating conversation, and thank you for coming and taking your time to spend with us, to be able to let us understand this better.
Mayor, I have one quick
Thank you for having me.
follow-up question.
Never had a quick question.
I do. It's for Chief. But my question is, so we have a policy for 988, which is a transfer, but what about, sure, but what about mobile, the iPad, which is the mobile crisis?
We will get that.
Will we have one before they deploy?
Yes, we would have
Okay,
that.
thank you.
All right, we are
We're in a
adjourned.
trial right now.
Thank you. All right. Good evening and welcome to the City Council, Norman Utilities Authority, Norman Municipal Authority, and Norman Tax Increment Finance Authority meeting of January 10th, 2023. Madam Clerk, will you call the roll, please?
Councilmember Studley?
Here.
Councilmember Schuler?
Here.
Councilmember Lynn?
Here.
Councilmember Grant? Here. Councilmember Tortorello?
Here.
Councilmember Foreman? Here. Councilmember Holman?
Here.
Councilmember Peacock?
Here.
Mayor Hykela?
Here. Thank you. Would you join me in the Pledge of Allegiance, please? I pledge
allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Now it's time for council announcements. I'd remind council, please no political speech or campaigning. Councilmember Studley, would you like to start?
I have no comments.
Thank you, ma'am. Councilmember?
Yes. I have two announcements, I guess. Today is an election day. I know that that feels very weird, and everyone is wondering. I got lots of calls about what was happening today. So just to be clear, we are voting as a city on the OG&E franchise agreement today. So if you are just now hearing that we have an election, you have until 7 p.m. to get to your polling location to cast your vote on that one item. The other announcement that I have is we are still seeking interested individuals who would like to serve on our comprehensive plan committee or the committee that is going to be working with Strong Towns over the next 2 years. So both of those will be kind of a 2-year commitment, but we are looking for people from our wards to step up to serve in those capacities. So I think we still need a number of people that are interested. I don't believe we've had anybody from Ward 2 apply, so you can send me a resume, or you can go onto the Boards and Commissions page on the city's website. There is a drop-down bar to say which one you would like to be selected for either the comprehensive plan or for Strong Town. So please look into both of those items, and if you are interested to serve in that capacity, we would love to review your application. That's all I have. Thank you.
Thank you, ma'am. Councilmember Lynn?
Happy New Year to everyone. Hope you had a great holiday break. For me, I've got some personal news I'm going to share with you. February 13th, I start my master's in divinity with Liberty University, and I plan on launching a church geared towards those who serve, military and first responders. And it's just a little personal information that I felt compelled to share with everybody. Other than that, let's rock and roll.
Thank you, sir. Ma'am?
I would just like to thank Ward 4 residents who've reached out about the Strong Towns Committee and comp plan. I've had a lot of response. So far, 16 of you reached out. I just want to say I'm really impressed that some of you were from newly reapportioned areas. You come from Ward 2 to 4 and come from all different backgrounds. Like somebody works in the FFA, somebody is a social worker, other person's an artist. I would say if you're listening and need to reach out to maybe a different ward, somebody in ODOT might be good, or if you live around a school, especially if you're somebody who lives around a school that sees a lot of traffic. Comp plan will be determining how we put schools in neighborhoods and work around how Norman's supposed to look in 50 years. So I just want to reiterate that too. And that's it for me.
Thank you, Councilmember.
Hey, I just want to thank Ward 5 members who've already submitted their names to me. I got about 13 people to serve on the two most important committees, the 2045 or the 2040 Land Use and Transportation Plan and the Strong Towns. Other than that, thank you and have a nice rest of the night. And you've got about 10, 15 minutes left to vote if you haven't voted tonight, and thank you a lot. Thank you.
Councilmember Foreman?
Contrary to council conference, I have no comments.
Thank you. Councilmember Holman?
Thank you. I do want to encourage people to go vote this evening if you haven't and
would like to, but also to encourage you to get registered to vote or update your status, I believe by the 20th, so next Friday, next week, in order to vote in the February 14th elections that are coming up. So make sure you get registered for those and consider, take a look at the school bond that will be on the ballot and make sure you're up to date on all the information you need to cast your ballot on that one. And I also want to mention another issue. It's personal to me. I've spent the last couple weeks moving out of the house that I've lived in for the last 11 years. Not really by choice, but the owner of the house was made an offer they couldn't refuse, and they decided to sell it. And it's over 100 years old. It might be the oldest house in Norman south of Lindsay Street. I'm not sure, but based on the architecture and the style of it, there's no other houses that look like it in the area. I had hoped that one day I'd be in a position to maybe purchase the house from the owner and potentially restore it to what it may have looked like originally when it was built. It has a 100-plus-year-old elm tree in the backyard and 19 total trees that surround the whole house. It's 1 block south of College. 1030 College is the address. It's across the street from a house that looks like a cow. It's called the Cow House. So many people are familiar with it because of that. It's on the South Greek row, basically. It's sandwiched in between a fraternity on one side and a fraternity on the other. It's the longest I've ever lived in a single place in my lifetime. As far as, I've lived in Norman almost my entire life, but I've moved around a lot, especially when I was growing up, various different apartment complexes and things like that. So this has been the most stable living situation that I've ever had, and it has definitely been very difficult to walk away from it. I am thankful that the company that did buy it, they've been extremely accommodating for me as far as finding a new place, which is not very easy to do. My city council ward was the only ward that lost geographic area in the recent reapportionment due to population growth. So the area I have to look is smaller, and almost the entire campus is in my ward. So you can imagine trying to find a rental in the middle of the school year is not particularly easy. There weren't very many options, but very thankful we did find a place in Ward 7 and still right close to campus, thankfully. So I'm excited about that. I'm excited that the move is over. And I'm also thankful that the company that bought the house was very willing to work with me and allow Habitat for Humanity to come in, and they are salvaging everything they possibly can out of the house. And one of the reasons I wanted to mention this is that they're going to need some volunteers over the next week or so. So if anybody out there is interested in helping to deconstruct a 100-plus-year-old 4-square, 2-story Craftsman bungalow and make sure that the pieces of it can continue being used in other housing options in Norman for years to come, they definitely need volunteers. And I would encourage you all to reach out to me if you are interested. My ward email, ward7@normanok.gov. You can text or call me as well, and we'll be coordinating that effort over the next few days to get everything out of it as they prepare to, unfortunately, remove the structure as they did with the abandoned apartment complex that was next door to me for a number of years. So they have plans for a redevelopment project that I've also been meeting with them on. I felt that if this is going to come down, at least let's try to replace it with something worthwhile. So I do appreciate that effort. I appreciate the accommodation, as painful as this is for me personally, to lose this house. I just care about it so much. It's really been a challenge. But I encourage everybody to go drive by and take a look at it if you can. It is a piece of Norman history that can't be replaced, unfortunately, once it's gone. But and I would also mention that they've been very accommodating with trying to design their new project around the 100-year-old elm tree so that that might be preserved on the property as well. So I just want to mention that to everyone and let you know that I'm still in my ward, I'll still be here, and that we need some volunteers if you're interested in helping to take the house down or remove all the fixtures and wood and floors and all that before it's torn down. So that is all I have this time. Thank you all very much.
Thank you, sir. Councilmember Peacock?
No announcements. Not going to try to.
Good, you all use that. Only announcement I have is when you're turning in an application or you're turning in your name to the council members and doing things for these plans, please turn in a resume. You'll go on to the website, city's website, go over to council committees, and you'll find a place to be able to put your resume in there. We want to make sure that we pick the most or the best applicants for this job, to be the planners that are going to find out how we're going to build Norman. So I appreciate that. And they need to be Norman residents. Thank you, Madam Clerk. That would be an excellent thing to do. Also, as other council members have mentioned, on February the 14th, there will be another set of things that we vote for. Please educate yourself, and if not, ask us, and we will be happy to help you in doing that. All right. Next item on the agenda, consent docket. Items placed by unanimous consent can designate those routine agenda items that they wish to be approved or acknowledged by one motion. If any item proposed does not meet with approval of all council members, then that item will be heard in regular order. Staff recommends that items 1 through item 22 be placed on the consent docket. I need a motion to place items 1 through 22 on the consent docket.
So moved.
Second.
I have a motion and second. There's a motion on the floor to place items 1 through 22 on the consent docket. Council members, you may cast your votes.
All votes have been cast, and the motion to place items 1 through 22 on the consent docket passes unanimously.
Thank you, ma'am. I'll entertain a motion to approve the consent.
So moved.
Second.
I have a motion and second. Are there any comments from council regarding any item on the consent docket? The motion on the floor is to approve the consent docket. Council members, you may cast your votes.
All votes have to approve the consent docket passes unanimously.
Thank you, ma'am. Excellent. Thank you. Item number 23, consideration resolution R222353, amending Norman 2025 Land Use and Transportation Plan to remove property north of Indian Hills Road and a quarter mile east of 48th Avenue Northwest from the low-density residential designation and office designation and place it in the mixed-use designation. I'll entertain a motion to adopt or reject the resolution.
Motion to adopt.
Second.
I have a motion and second. Is there a representative here for the applicant to make a presentation?
There is. Thank you, Mayor. Gunnar Joyce with Rieger Law Group on behalf of the applicant, Premium Land. We also have basically the presentation for, I believe, items 23, 24, and 25, which is the 2025 amendment, the PUD rezoning, and the preliminary plat here. So I'll cover all three items here as we move forward. But with us tonight as part of the development team, Zach Holland is with the applicant, Premium. We have Kendall Dillon with Craft and Tall, the civil engineer on the project. Behind him, right behind my empty chair, BJ Hawkins with TEC, who did the traffic report. And then rounding out the team, Libby Smith and Sean Rieger with Rieger Law Group. So just as you said here, we are just north of West Indian Hills Road in between 48th and 36th Avenue Northwest. You can see the proximity here to I-35. I'm sure you're aware, and we will touch on this, a lot of public infrastructure and traffic infrastructure coming into this area. So we believe it's a really good spot for this 80-acre mixed-use development. And just to finish out the slide here, you can see the black dashed line. That's the city of Norman city limits that rolls right through here. So we're at the very north tip of the property. And also just to point out while we're on the slide, you can see that more up here is pretty developed out with a lot of residential neighborhoods, and there's even more housing that's not shown on this image. We really like that we have a commercial aspect here to kind of poach away some of those sales tax dollars from those more residents as they leave and go to the city. So this is the 2025. This is item number 23 tonight. As you see, this is the existing comp plan map. We are this 80-acre tract, just the eyelash under 80 acres. Currently, we're low-density residential with office on a portion of the Indian Hills frontage, and we are proposing basically right down here, you see this purple mixed-use designation. That's what we're proposing up here as well. And as you can see in the surrounding areas, kind of that hodgepodge of colors shows the mix of uses in this immediate area, which is what we're proposing as well, mixed use. Here's the existing zoning. Essentially, it's R1 single-family residential today with a portion of CO commercial office. We're proposing, as you see again in the surrounding area, to go to pink, which is PUD. And also to point out here, again, to justify kind of the mixed-use development and the commercial aspect that we have, these pink areas have a whole bunch of residential entitlements currently. So you see down here, this is going to be a whole bunch of single-family and other residential opportunities. As I pointed out, in Moore right now, a lot of single-family housing, and so we really like the aspect of our commercial design to support the housing in the area. Planning Commission, this was the site plan that was presented about a month ago, and Planning Commission approved unanimously with 3 recommended design elements. And so this was the site plan that was presented at Planning Commission. You could see track 1 up here is the commercial uses. Track 2 is essentially garden-style apartments. Track 3 is duplex. And then track 4, single-family residential. Planning Commission, very complimentary of the design, a 9-0 vote with 3 recommendations. One was to look at reducing parking in the commercial area. We have not drafted in a parking maximum, to council's credit, with that being now recommendation only. The design is what is suggested under current code, but our PUD does not cap it or require a max. We noted that, but Planning Commission said, what if on the site plan we showed a little less anyway? So we've reduced parking on the current site plan. We'll see that in a second. Another comment that was made both by an attendant at Planning Commission and then also echoed by planning commissioners was to break up this large single building of commercial and to improve kind of pedestrian connectivity and walkability within the site. That's something we have done, taken that into consideration, and the applicant has changed the design here. And then finally, you'll see here, there's a parkland dedication up here in the northeast corner, and it kind of continues along the detention pond for a walkable green space. We'll touch on this in more detail, but this is part of a kind of master park proposal that the city of Norman adopted in 2010. We kept the same intent of that 2010 plan. Planning Commission thought, well, what about going ahead and connecting all the way to the west? And so that's something we have also done in the latest plan. So now there's a connection not only from the east, which is the 2010 plan, but we go all the way up to the west. And so I'll go ahead and show you that now. This is the new proposal. You'll see we've got the 3 new design changes. There's approximately a 10% reduction in the parking in the commercial area. And again, we are not requiring that amount. So when we have an actual end user, they're the one that'll come put in their actual parking count at final plat stage. As you see here, we've busted up the single large kind of big box store. You have 2 commercial buildings now with a walkable plaza that connects into the apartment space. And then right up here is this connection, this green walkway that connects to the parkland, walkway by the detention pond, and then all the way up into the west development up there. So this is the new site plan. Now I'll take you real quick through the rest of it, kind of the legalities. The proposed PUD document is obviously the narrative in the draft that says everything that I'm saying to you. Track 1, about 28.6 acres. That's going to be the commercial site. Track 2 is our garden apartment multifamily, basically a cap of 400 units. Again, all of that gets absolutely finalized at final plat stage. We're just at kind of preliminary plat tonight. Track 3, 2 family duplexes about 6.5 acres, 28 lots, platted lots. And then single family, we're showing 88 single family lots. So the theme here and our goal is to provide master plan community with a diversity of residential opportunities in the area. So we're not just kind of flooding the single family home market. We've got duplexes, we've got apartments, we also have single family homes. And we also, very, very thoughtful design is to protect the single family, protect the duplex from the increased noise and the increased traffic that's going to come into this area, whether that be through the City of Norman projects, which is 36th Avenue expansion project that's ongoing, or whether that's through an ODOT OTA project that we're probably all familiar with and we'll touch on in greater detail in a second. This is item number 25, I believe, the preliminary plat, the final one, which just is the legalities that sever these 4 tracts up into individual lots. We've got 1 proposed platted lot for commercial, 1 proposed platted lot for the apartment. It's 28 proposed lots for duplexes and 88 proposed lots for single family. Just real quick to touch on it, because it's not very often I get to stand up here and say both Greenbelt and Parks Board had very complimentary comments to this applicant, so I figured I'd give them their kudos while we're here. The 2010 master plan, the Gateway Parks and Trails master plan, called for a park dedication in the very northeast corner of this applicant's property. And this was before the current applicant owned it. So right here you see in the red outline is the 2010 parkland dedication proposal. And really this applicant's property stops basically right here. So this is the edge of it. And then everything that you see east or moving to my right is off property for this applicant. It's the neighboring property to the east. And that plat still has this same concept. So this all still is intact from the 2010 plan. And then it crosses 36th Avenue and even abuts up against kind of I-35, which is a major park layout for the city of Norman. So when we came through the preliminary plat, you're allowed to either do private parkland, you can do public dedication here or fee in lieu of, and that's what we have done here is the public dedication of 2.66 acres up in the northeast corner of the site. Per code, per the ordinance, it would be a 2.6 acre dedication, so this applicant has exceeded that with 2.66 acres. Both comments here, you've got the comment at the bottom is from Greenbelt Commission, where they commended the applicant by keeping the Greenway Master Plan in place with this proposal. And then to the right part of the screen is a staff report quote from Parks Board noting that Parks worked well with the developer, with the applicant here, to keep the 2010 plan in place. And so just to let you all know that that proposal, that plan to keep the public parkland has been well received by staff on multiple levels. To round it out here, and why we think this is a great area for this mixed-use development, is the Access Oklahoma project. I'm sure you're all familiar with it. Right on Indian Hills Road, ODOT OTA is proposing a turnpike. So how are we going to develop our land with this unknown right now of what's going to happen? Well, a thoughtful layout, kudos to the engineers, kudos to the applicant. This plan works regardless. This plan works if the turnpike does come through. This works if there is no turnpike and it's just the city of Norman's infrastructure that's coming in on 36th Avenue with a 7-lane intersection. So if ODOT comes through, essentially we understand the right-of-way is going to take out the first layer of commercial, but we still achieve our desire of a buffer from the increased traffic and noise, protecting the residential, as we still have an area for commercial, we still have an area for apartments, we still have an area for single family. And if it doesn't come through, we still have the ability to increase our commercial, and there will still be private and public infrastructure in place through the city of Norman's projects on 36th Avenue. So we think a very thoughtful design that accommodates both results. In order to do that, we have a phasing plan built into the PUD. Phase 1, first out of the ground development, is contemplated to be single family, which is to the north. So everything that's not colorized would be the contemplated Phase 1, the access roads to get us back to the parkland, to get us back to the single family. Phase 2 being duplex, Phase 3, the apartments, and finally rounding out final form of development, Phase 4 is going to be the commercial area. So just to summarize this plan, I think we've talked about a lot of it, but really it's a prime location giving private investment in the area, public investment in the area, the infrastructure that's coming, whether that be City of Norman infrastructure or statewide projects, and the thoughtful design that protects single family and the diversity of residential opportunities that we're bringing to the area. We have not received any formal protest. Planning Commission unanimously approved with those 3 design recommendations that were put into the final plan. And as we noted, we did receive positive comments both at Greenbelt and Parks Board. I'm very happy to take any questions on any of the 3 items. Thank you.
Any questions from council? The buttons aren't working? Okay. Councilmember Grant, I'll start with you.
What are the starting prices of these units, like the apartments, duplexes, houses?
At this point, that's something that we don't know, something the landowner doesn't even know yet either. A lot factors into that with the market absorption, cost of materials, and it's
So I'm
just,
here, maybe not like in the affordable housing range. Okay. Are there any ADA units in this planned community?
again, I think at this stage, that's not a requirement in the PUD. It's something they could do voluntarily, but still just at the higher level of zoning allowance and not end user specific yet. That's something that would come along kind of at final plat when they really get into the nuts and bolts of who that user is going to be in those tracks.
And then maybe you covered it. I don't know. I didn't catch it. Stormwater, how's this thing drain?
Mm-hmm. Yeah, so the PUD requires the preliminary drainage report to be submitted with the preliminary plat. That has been submitted and reviewed by staff. There are adequate and exceeding the City of Norman requirements with the detention ponds that are shown throughout the plan. When you come at final plat stage, you'll have to have the final drainage reports and the final solutions for each phase. And so that's something that at this point we have provided adequate preliminary designs for. And when it's final build out, that's again addressed.
No more questions.
Thank you. Councilmember Peacock.
Thank you. Just a couple comments and then a couple questions. First, I want to commend you guys on taking the Planning Commission comments and implementing those into the design, especially the reduced parking. I mean, I'm sure you know how much that makes me happy. But secondly, this through corridor, where you've actually increased the connectivity between the residential side and the commercial side. I think that's really important and something we lack a lot in suburban neighborhoods or suburban developments these days. So I want to commend you on those 2 points first. Second, I see a lot of trees on this site plan. Is the PUD calling for anything above the landscape ordinance, or are you basically just standard landscape ordinance?
It's the standard landscape ordinance. That actually, why it showed up on the plan was a really good comment at Planning Commission. I believe it's Commissioner Jablonski. We didn't have any shown, and he asked, are we asking for a variance from it? And we're not. It is in the PUD that we are complying with it, and so we've just kind of shown that.
Okay, excellent. And in the scenario that the turnpike does come through along Indian Hills, I noticed that it wipes out basically this front detention portion. Do you think you guys will still be able to meet the detention requirements on the remainder of the site if that goes away?
Right, yes, we do. And also, it's a very good point. The actual final design may fluctuate, and if it's to an extent that it requires such a fluctuation that it's no longer, in kind of an immaterial site plan, we would have to come back to you guys with a site plan amendment.
Excellent. Appreciate the answers.
Yeah, absolutely. Thank you.
Councilmember Hellman. Thank you. I forgot you. Sorry, went out of order.
Sorry. So I guess my questions are basically for my own knowledge, but also that our public can understand the nuance here that since we're at the north end of our, jurisdiction, and the northern part, of a protest area would be outside of our community. Can you explain the nuance there? Are those individuals still, given notice that this is coming through, even though they are in a different city?
Yeah, they are. It's a statutory requirement, and so we did still send out those notices and did not receive any calls or letters from even the Moore residents.
Okay, awesome. And then in terms of, just kind of just another general clarification of when you have a PUD and you have a site plan, how beholden to the site plan, because what we're seeing here is really wonderful, and kind of these renderings and ideas. So just for us and for the general public, is this what we are expected to receive once this is approved?
Right, yeah, yes, that's the expectation. So what the legal standard is essentially a substantial deviation, whether it's a material change or not, and kind of what we've always had as a rule of thumb, and you can ask your staff as well, but essentially, if we show up and we increase density or we increase kind of impervious coverage, which has stormwater impacts, that's something that triggers us into a site plan amendment. If we ever come back and show anything that's less intense, like we take buildings out, we do less parking, for example, that increases our pervious area, which is a good thing for stormwater drainage. That's like a change. That's a change that we would be allowed to make.
Okay, and then I believe there was, when we were talking about the potential for the turnpike to come through, if that were the case, is this attached also to the PUD? I was trying to pull it up, but this separate site plan in the case that is triggered?
This is not.
Okay.
This is just an overlay on top of the front portion. What our understanding is that we're going to final plat essentially from north to south. And so we believe we won't ever have a substantial deviation from our plan until we get to the commercial area. Now, that isn't in gold yet. That could change if ODOT came tomorrow, and maybe we're doing different things, but that's part of the difficulty with the plan is ODOT has really kind of thrown a wrench in this property owner and a lot of property owner in Norman and their plans for the future. So this specific thing isn't, but that's what we believe is coming. And then as long as we are final platting kind of the north and there's no substantial deviation on how we get there through our preliminary plat, we believe we can continue to go forward.
Okay, so just to kind of clarify and give some, I guess, layman's terms for the general public, if this were the case and the turnpike, is approved and ODOT comes through, it will come back to us at some point if there's a substantial deviation. So we might see this come back to us just for that specific purpose. But
You very well could, right.
yeah, and I would just, I guess, I was going to make comments later, but just to the public that this is the issue that we have as a community when faced with turnpikes coming through, right? We have property owners who would like to develop their properties and, bring new ideas and community plans to, Norman, but how can they do that? And they're having to spend considerable amount of money and thought into what is the scenario if the turnpike does come through. So just as we're thinking about continuing that fight as a community, this is a perfect example of why that's really challenging, and we should have been at the table from the beginning. So thank you.
We appreciate that comment. I know the property owner does as well. Thank you.
Councilmember Holman.
Thank you. A couple of my questions were already asked and answered, but you mentioned this property it is a current empty field, but it has been zoned in 2010 as the entire thing as single family. So it could be developed today as a fully single-family residential neighborhood.
Correct. There's a little piece, just a tiny sliver that's commercial office, but exactly right.
Okay. And you mentioned that you think the viability is there regardless of the turnpike. So this piece of property in this development isn't necessarily more or less attractive whether this goes through or not. This is attractive either way, I guess you could say.
This proposed plan, we
Developing this piece of property.
Right, yeah, we do.
And you mentioned the 36th Avenue project, but we also have a voter-approved project to widen Indian Hill Road from I-35 to 48th Avenue. I didn't know if we might have staff maybe speak about that project or the timeline of it. And I know we have some uncertainty because are we going to spend our own local money to widen a street that might get, who knows what's going to happen with it.
Right.
And so, yeah, I might ask city staff to maybe talk about briefly the Indian Hill Road project. And and the status timeline maybe of what we're thinking with that. And mainly that the intent, I guess, had always been that this corridor was going to develop in this type of way.
Yeah, thank you, Mayor and Council. Sean O'Leary, Director of Public Works. I might have to call on Scott Sturts, our city engineer, to help me with the timeline. In fact, Scott, why don't you come on down while I'm doing the preliminary comments. So yeah, this, it might go back a slide or two here. And you can kind of see here, 36th Avenue is this section. This is the proposed turnpike. So the heavy line, the heavy kind of purple line here would be the center line of Indian Hills Road, roughly, I think. Is that, Scott? Is that right, or is it the southern frontage road? Okay, could be the southern frontage road here. This portion from 36 to 48, which is right here, is in your 2019 transportation bond program. I think it's scheduled for 2028 or so in the latter part of that program. And just like was mentioned here with regard to this development, we are in a holding pattern, naturally, with the turnpike proposal. And of course, the timing works well. They will make those decisions well before 2028. But we anticipate that if the turnpike comes through as planned, the Indian Hills Road portion of that bond issue will not be built. That money will go back into the bond program, and council will have a choice on how you want to reallocate that. You could reallocate it to another project in that program. For instance, also in that program is this portion of 36 from here, Indian Hills Road, up to the north city limit line. You could reallocate it to that. There's a number of options you'll have there, but right now we are still planning to improve Indian Hills Road to a 4-lane city arterial street. And if that gets replaced by a turnpike, all bets are off. Indian Hills Road becomes a frontage road for the turnpike system, and we would no longer do that project. We would do the 36 project, I think, through the turnpike, and we also have plans in the future of doing a 48th Avenue improvement from Indian Hills all the way south to Robinson Street. In that 2019 bond program, only the portion of 48th from Tecumseh down to Robinson is currently funded. Does that help?
Absolutely, I appreciate that info, Sean. Just kind of wanted to help everybody understand the history of this area and that we have existing voter-approved bond projects to improve the street infrastructure in this area regardless of the turnpike. So I would assume that if turnpike doesn't happen and we improve Indian Hill Road, that would continue to make it an attractive location for this type of development, most likely. Thank you very much.
Thank you. You bet.
And I would just mention that I do appreciate higher use of the property, I guess I should say, instead of just all single-family R1 zoning. I really do appreciate kind of increasing the use and what I would call highest and best use, I guess, of this piece of property. And I think it would make sense, as you mentioned, that there doesn't seem to be a lot of other commercial in these other developments, especially on the Moore side of things. So it makes sense. Thank you for answering the questions.
Okay, well, this is anything more from council at this time? There'll be another time. This is an opportunity for members of the public to make comments regarding this item. Madam Clerk, are there any people
I
signed
have
up?
one signed up, Jackson Latham.
Mr. Latham? I'm not hearing from him. Anybody else?
That would be the only one I have.
All right. Any final comments from council? Okay. The motion on the floor is to adopt the resolution. Council members, you may cast your votes.
All votes have been cast. Adopt the land use plan resolution passes unanimously.
Excellent. All right, item 24 is a follow-on. Consideration of ordinance 2223-16 upon second and final reading. An ordinance rezoning property located north of Indian Hills Road and 1/4 mile east of Northwest from R1 Single Family Dwelling District and CO Suburban Office Commercial District to PUD Planned Unit Development District. I'll entertain a motion to or reject the substitute ordinance on the second reading, section by section.
Second.
I have a motion and second. This is a companion item to the previous item. Are there any further comments from council regarding this? Votes.
All votes. Motion to adopt the ordinance as substituted passes unanimously.
Excellent, thank you. And item number 25. Oh, final reading. Sorry, I always forget that. I'll entertain a motion to adopt or reject the ordinance on final reading as amended.
So moved.
I have a motion and second. The motion on the floor is to adopt the ordinance on final reading as amended. Council members, you may cast your votes.
All votes have been cast, and the motion to adopt the ordinance as substituted passes unanimously.
Thank you, ma'am. Item number 25, another follow-on. Preliminary for Redlands Edition, a planned unit development generally located 1/2 mile west of 36th Avenue Northwest on the north side of Indian Hills Road. I'll entertain a motion to approve or reject the preliminary plat.
Motion to approve.
I have a motion and second. This is a companion item to the previous two items. Are there any further comments from? Hearing none. Madam Clerk, are there any comments? Hearing none. The motion on the floor is to approve the preliminary plat. Council members, you may cast your votes.
All votes have been cast, and the motion to approve the preliminary plat passes unanimously.
Excellent. Thank you, ma'am. Thank you, Gunnar. Item number 26, consideration of the recommendation from United Way of Norman to provide grants using the American Rescue Act Plan, ARPA funds, to qualifying local nonprofits. Contracts K222388 through K2223107, allocating ARPA funds to nonprofit recipients as recommended by the United Way of Norman and as outlined in the staff report, and budget appropriations as outlined in the staff report. Okay. Says, I will make a brief statement beginning this item.
Go ahead and
You want-
Yeah, go ahead and say that.
Council will have two votes on this item. One is to accept or reject the recommendations from United Way of Norman, and one to approve the contracts and subsequent budget appropriations. We will only be taking public comments one time, so you may speak to both motions when it is your time to speak, if you like. I will entertain a motion to accept or reject the recommendations from United Way of Norman for the allocation of ARPA funds to qualifying local nonprofits.
Motion to accept.
I have a motion and second. I would like to recognize Darren Wilson, Executive Director of United.
I think it's going to be somebody else.
Oh. You're not. You're faster than I am, though.
I will. Thank you, Mayor Heikela and council members. I'm Diane Murphy, and I do work for United Way. I'm the Director of Community Impact, which means that I get to work with all of our great nonprofits in Norman. So we really appreciate, as a United Way, your trust in us to do this project for you. It was a very fast and intense time that we spent on this project, and I would like to introduce Mandy Muma. Mandy is the chair of the ARPA committee, and so she's going to present to you what our recommendations are to the city council.
Thank you, council members, for this opportunity. To go forward, you go back. All right. As you're aware, the city received around $22.2 million of federal stimulus funds for the ARPA funds, and the council authorized around $1,700,086 to be granted to local nonprofits, and you contracted with United Way in September to help allocate those funds and make recommendations to pour through those applications and administer selection. A special ARPA council, Impact Council, was activated, of which there are 8 members, myself as chair, and the current chair and vice chair for the 3 Impact Councils that United Way has in the areas of education, financial stability, and health. And then there were 2 outside additional community members that were not associated with the United Way. We met in November and reviewed and scored the applications that were received. We were able to meet twice in person with the full Impact Council to pour over those applications, review our scoring, and make the recommendations that you see in front of you today. In total, there were 34 applications received that were for about $5.5 million in funding. We found 20 of those applications met those ARPA guidelines, and the $1,786,000 in ARPA funding was recommended for award amongst those 20 applicants. And then you see before you our funding recommendations, ranging from the smallest at $4,500 to the largest at $300,000 for a total of the $1,786,000. Let me go back. And at this time, if there are any questions, I will entertain those.
Could you maybe just go over a little bit of the, what was the criteria specifically that the organizations would be trying to form their responses towards? And did you happen to get any feedback from any of them about, did any of them have, were any of them unclear about what the stipulations were or what they were should or shouldn't be including in it or not?
The application that was on both the Norman City website and the United Way linked back to the Treasury packet that gave instructions on what the eligibility was. But we did go through that as a council as well. You had to have had a financial hardship that was in proportion to kind of the impact that nonprofit incurred, and their application had to be tied directly to COVID. So that COVID pandemic had to be the catalyst that drove their application. And there were some applicants that we definitely recognized that organization was impacted, but their ask and their application was not tied into COVID, and we did give them kind of an opportunity to talk about that, but we did base our selection and our scoring based on the application alone.
And the
And
link to COVID, that was,
I was just going to do you allowed for a nice segue, Councilmember Holman, to the slide that points out that in the application, it indicates that the applicant needs to retain records and show how their program funding was spent, so that if, in the case of an audit, if the money did not tie to the ARPA final rule requirements and the city had that money recouped, we could go back to the agency that did not utilize those funds appropriately.
okay. And so, and you would say it was very clear or a main point in the application that this must be tied to COVID?
Yes.
In some way?
Yes, and one of the questions was, how was this application impacted by COVID? So yes, there was those opportunities to indicate as such.
Thank you.
That question, can you hear me?
Yes.
So we talked about this the last time you were at study session.
Mhm.
So during the process, if you received an application that was requesting money but didn't follow the guidelines, was part of your process was to go back to the organization and ask them, is this what you intended to ask, or were you looking for something else?
If we had questions upon the application, we went back to that organization, but stopping short of saying, are you sure this is what you wanted to ask for? Because we don't want to put that, we're, as a council, we didn't want to make that leap in the chance that there was recoupment back on the city.
And Councilmember, to be somewhat fair to United Way, Diane and I went over this. We also, the finance staff and myself, had a Zoom meeting with the ARPA Impact Council, and they were specifically advised by the Norman's legal department to not put words into the applications that were not actually there. Because again, if the request and the program did not meet the ARP, the Treasury Department's final rules and regulations for using those funds, once we, as the actual recipient, gave these funds to a subrecipient that was not intending to use it in the means that was requested in the final rules, the city runs the risk of having those funds recouped. So our legal department was very clear with them about they couldn't fill in, the United Way could not fill in the gaps in those applications for the applicants.
Got it. So bottom line is that the criteria was clearly outlined and explained on the packet and on the website on how the money and how the ask was supposed to be processed by
Right.
the applicants.
Well, the press releases from the City of Norman and from United Way referenced that these funds were to be used to address needs caused by COVID. And then there was a link in the application at the end that indicated this applicant has to comply with state and local and federal rules and the requirements listed in the final rules that are attached here. And most of the applicants filled them up, and you could tell from their applications because they were using the key words from the Treasury Department summary that they had done, basically their schoolwork and had read those 43 pages and the 2 pages specifically addressing nonprofits just by the language they used in their applications. And then I believe there were some that did not pull that link up that really walked them through. Here's what the Treasury Department requires you to do. Here's what the definition of an impacted population and disproportionately impacted population is. Here's a location that presumes you were impacted by COVID. It was all in those pages. And again, Ms. Muma is correct. In the application itself, there was a question that said specifically, how is this program addressing COVID needs? And that was a specific question.
Thank you for that clarification. Appreciate it.
Just to follow along with the line of questioning that Councilmember Tortorella was just asking, just a little bit more clarification so I understand. Were there interviews done of some of the applicants or all of the applicants in this process by the council?
Not necessarily interviews, but if we had questions, we would reach out to them and have them answer those questions.
Okay.
I wouldn't could say that we didn't bring everybody in to say, let's go over your application.
Got it. And then, so were some of those questions just clarifications on items that they might have put into their application?
Yes, some of them were maybe a budget item, or in one case, it was your budget doesn't even show the need for this, so show, where we're not understanding things.
And so back to this idea of not putting, I guess, words in nonprofits' mouths, but if they were able to clarify their ask in that request for additional information, would they have been maybe applicable or not? Or were you still going directly off of what words were in the application?
Primarily the application, unless it was something that was clarifying what was in the application. So we were not filling in those gaps.
Perfect. Okay, thank you for that further clarification.
Yes.
This is an opportunity for members of the public to comment.
Let me get back to we will start with Stephen Ellis. I will tell you, our timer on the podium is broken tonight, so you won't be able to see when your time is up. Okay, I'll wave my hand. I'll wave my hand.
Or at least, go like this so I can,
I'll wave my hand.
633 Reed Avenue. I wanted to follow up on the questions about sort of the criterial decision-making as well. I mean, partly, I don't think it's any secret I have a dog in this fight, but I don't want to particularly talk about that sort of issue. But sort of, by profession, I'm a decision theorist, so I'm interested to see how people do make these sorts of decisions. And what I was wondering was, first, did the city provide any sort of criteria for assessment other than sort of mere eligibility criteria? Was it open ask as long as people met the federal eligibility requirements? And I take it that it probably wasn't the case that the eligibility, that the asks that qualified under the federal rules didn't match exactly the amount of money spent. So it seems like there was some kind of ranking criteria. And so I'm wondering about the ranking criteria and whether or not it would have been possible for, say, for example, a new charity to get any funding if they were responding to COVID need, because it seems like there were some questions about that. And I was also wondering in particular, and I hate to bring up a particular example, but I just found this one particularly curious. The Bridges ask was for an employee that looks as though Norman used to pay for it, at least the Norman Housing Authority. So I was wondering if sort of how that fit into the sort of criterial decision-making. I mean, I think Bridges is great. I used to drive a kid who lived up at Bridges to school every morning for a semester. So I think they do a great job, but I was wondering whether or not the age of their facility was really a COVID-related kind of issue if you look at the packet about that. So I guess my question is, in addition to eligibility requirements, what were the criteria used to rank everybody who met the eligibility requirements? What were the judgment calls that were being made? Was any of that guided by the city asking for particular kind of things? Was it completely up to United Way? And if so, what was it? Thanks.
This person wasn't here earlier, but I'll give him one more chance. Jackson Latham. Okay. I'm probably going to mess this up, so I apologize ahead of time. Pat Chanicki.
Pronunciation, thank you. Mr. Mayor, council members, members of United Way, excuse me. My name is Pat Chanicki. I'm the president of the St. Thomas More Conference of the St. Vincent de Paul Society. I've been a Vincentian for about 6 years, and I don't know why I'm so nervous, and president for 4. During my rather short time with St. Vincent de Paul, one of the things I've come to understand is how things that impact middle class and upper class people slightly or not at all can have a devastating impact on the poor and the working class. And that includes everything from natural disasters to a tiny virus. I've had the privilege of visiting people in their homes when they call and say, I need help with a utility payment or a rent payment. In fact, that's our modus operandi in St. Vincent de Paul, we go 2 by 2, but this one-on-one conversation with people. OG&E and OEC, as good as they are, aren't going to sit there and listen to their story. The landlord doesn't have time to understand why they're late with their rent payment. But that's something that we as a society, as a St. Vincent de Paul Society can do. And in fact, the hope that we bring to these people is probably far more impactful than whatever small amount we can offer to help towards their rent. So I'm just delighted to know that we're in consideration. I'm so sorry. That we're in consideration for this grant because we're going to be able to extend either the number of people that we can help or the amount with which we can help those who are most impacted by COVID. And we are seeing requests right now for utility bills in the neighborhood of $500, $600, $800. We've never seen this before. So the extra 100 that we can give them is going to go a long way when we collaborate with our other St. Vincent de Paul societies in town, St. Mark's and St. Joseph, with Catholic Charities, with Food and Shelter, and the other nonprofits with whom we interact. So thank you for your consideration.
Kelly Deaver.
Thank you to council and to United Way for the reason I'm here tonight. I am the president of,
Just say your name and.
Kelly Deaver, yeah. I am the president of the South Central District. So in a way, I'm Pat's boss. But I'm also my husband's boss. He's the president for St. Mark, which is who I'm here speaking for today because they're having their meeting tonight. So sent me instead. I want to say that having the ability to apply for ARPA funds was just a blessing to St. Vincent de Paul in general here in Norman. In Norman, there are 3 conferences. 2 of us applied. We thought, well, maybe one will stick. Thank you, Lord. We both stuck. St. Mark alone, over the 3 years that we call COVID period, gave out $250,000 in aid for rent and utilities and other needs. We had people who had never been unemployed, who had never had to ask for charity, come to us in our time of need, in their time of need. And our members were there. We never shut down. We worked through the whole time. And we were able to provide not only our help, but we have a resource sheet that's 2 pages of 10-point font of other places here in Norman, because Norman's such a great giving city, that could help. And I'm so proud to see that the list of the places that came through, most of them are on our resource sheet. Most of them are resources that we refer people to. And when we work together, we have a huge impact. So while our funds are small, combined with the money that we get from our church and from our other fundraisers, you put it all together, you guys are doing a great thing with these ARPA funds, and I just want to thank you for that.
For the allocation of ARPA funds to the qualifying local nonprofits. Council members, you may cast your votes.
Votes have been cast and the motion to accept the recommendations of United Way passes unanimously. Is that the one we're doing? The first one? Okay. Accept the recommendations from United Way passes unanimously.
Excellent. I'll entertain a motion to approve or reject the contracts for the allocation of ARPA funds to the local nonprofits and the subsequent budget appropriations.
Motion to approve.
Second.
I have a motion and second. Recognize Ms. Murphy again. Do you have anything that you want to add to that as a presentation?
Well, Heather Poole with the city's legal department, I'm going to step on her toes because the contracts is really my piece. Included in those contracts is a requirement that the applicants have to obligate the funds, the grant funds, and actually complete by December 31st of 2024, and actually spend all of those funds by December 31st of 2026. The contracts run through March 31st of 2027 because we are also requiring those applicants to make reports of how they have spent the funds and to retain the documentation, the receipts, the CPA-approved books, financial records that show how they have spent the grant money. And again, the funds have to be applied in the way that their application indicated they would be addressing the COVID pandemic emergency. And again, the reason that we have all those requirements in the contract is because the Treasury Department rules are that if they come in and they audit and they determine that the recipient's monies, meaning the city of Norman, was spent improperly by the subrecipients, these nonprofit grantees, then they would recoup the money. And so the contract set out that if that, in that event, that we can collect that money from the grantees.
Any council questions from council regarding this item? Hearing none. It's an opportunity for the public. No, nobody from the public. This is getting easier. No final comments. The motion on the floor is to accept the recommendations from United Way of Norman for the allocation of ARPA funds to the following local nonprofits. Council members, you may cast your votes.
To approve the contract.
Motion to approve the contracts. What did I read? Something else. Motion to approve. Okay, let me reread the motion correctly. The motion on the floor is to accept the recommendations from the United Way of Norman for the allocation of ARPA funds.
That's my fault, because I didn't word it right for you.
Okay. For
Motion on
the,
floor is approve the recommendation,
approve the recommend, the contracts for that United Way are recommended.
There you go.
Council members, you may cast your votes. Now we got it right. Vote on the right thing.
All votes have been cast, and the motion to approve the contracts and subsequent budget appropriations passes unanimously.
Thank you, ma'am. Excellent. With council concurrence, I would like to alter the agenda and move miscellaneous comments prior to us going into executive session. Any opposed? So moved, so done. So we will go into miscellaneous comments. Do we have anybody signed up for miscellaneous comments?
Yes, sir, we do. We'll start with Burgundy Fletcher. I'll just remind you all that the clock at the podium is not working. I will wave my hand when you have 30 seconds left.
Good evening, everyone. My name is Burgundy Fletcher. In August, I filed a missing person. I'm here to speak to you about police response to mental health crisis.
Yes, ma'am. Just please address the whole council.
I'm sorry, what did you say?
Just address the whole council.
Oh.
Individually.
In August, I filed a missing persons report for my 73-year-old mother with Norman PD. She was found within 48 hours, but officers told me she wasn't going to go with me, and they took her to an unknown hotel. 8 hours later, a different set of officers picked her up and, recognizing that something was seriously wrong, hospitalized her against her will. She is still hospitalized 4.5 months later. My husband was diagnosed with bipolar I disorder 11 years ago, and we just weathered our first manic episode here in Norman, Oklahoma, with 2 hospitalizations in Griffin, one in October, one at the beginning of December. I've had to argue with police officers for them to take him to the hospital instead of to jail. During crisis, my husband is threatened with violence and criminal prosecution from officers, these officers who are not mentally ill. I call for aid when my partner is suicidal. When officers make contact, they determine he's not suicidal. They don't talk to me, and they don't even tell me that they've found him. Often I am not believed, as if our times of crisis are domestic disputes, as if he just needs to sober up, as if he's not taking his medications, which I watch every night at 10 p.m. since 2015. as if he's just a dangerous guy. I'm not here to criticize police officers. They're just one piece of our society's broken mental health care, I like to call uncare system. I'm grateful that my man is alive. I'm grateful that he is back at home with his family, our 4 children, myself, where he belongs. However, there are several things that I've learned over the past decade as my partner and I have met the challenge of facing this illness together. Mental health crises zigzag jurisdictions and across ward boundaries and do not keep bankers' hours. Mania, depression, and other mental health crises are going to happen even when folks are taking their meds as prescribed. Chemical restraint is not the only answer, even though it's the go-to answer. Thank you for listening.
Thank you, ma'am.
Shannon Buckingham.
Hello. On August 19th, my mother arrived on a bus from Santa Fe, New Mexico, where she'd been living for 7 years. She was uninvited, and it was an unannounced visit. My sister and I had less than an hour and a half notice that she was coming. I volunteered to pick her up in Oklahoma City and bring her back to Norman, where I've lived for the last 40 years. When I saw my mother, she was filthy. She was not properly dressed, and she didn't know who I was until I was standing 5 inches from her. She was verbally abusive. She was saying things that any normal stranger off the street would know to be untrue. She was obviously in crisis. I started calling everyone I could think of, and my speech went something like this. My mother showed up on a bus, unannounced, uninvited. She is mentally ill. She is physically ill. She is severely malnourished. I fed her breakfast at La Baguette. Her teeth were falling out of her head as fast as she was chewing. I'd never seen anything like it in my life. My brain couldn't process what was happening. We took her to the hospital in Oklahoma City. They let her walk out. I took her to the hotel, the Holiday Inn in Norman, because I couldn't have her in my home behaving the way she was. It was terrifying, it was abusive, it was stressful. The next morning at 9 o'clock, I got a phone call from the Norman Police Department that she had shown up. And I told the officer, Officer Wu, what had happened. I said, she's unstable, she's mentally ill, she's physically ill, she needs help, can you help me? They refused to take my sister and I's third-party attestation statement last night at the hospital when she ran into traffic on 13th Street and was nearly killed 6 feet in front of us. He said, yeah, if you can come down here, I'll take your statement. Jumped in my car, came down to the Norman Police Department. He told me he could no longer take my statement because it happened the day before. I said, less than 12 hours ago, you can't take my statement? He said, no. I said, my mother doesn't know where she is. She doesn't know what day it is. She doesn't know who the president is. All of this is on body cam footage, by the way. He followed me back to my house because my mother told him that I had stolen all of her clothes, stolen everything she owned. We went back to my house. Then he told me, ma'am, I'm sorry, she's gonna have to go. It's 100 degrees outside. People will call. I called Adult Protective Services right then on the phone. So
Marguerite Larson.
I have grave concern as to what has been happening in our detention center. I feel that the city of Norman has definitely not fulfilled its obligation of taking care of its citizens. I feel that we have a mental health crisis that is not being fulfilled, that is not being substantiated, and we have a Norman Police Department who really should be turning these services over to a mental health care provider, which they are not. So my concern And my ask is that Norman deeply look into what needs to be fixed so that these happenings no longer happen. We have mental health care crisis, which is a mental health care. It's a disease. It's not something that people can control. We need to have someone in the city to help, to assist, and to start moving forward with our mental health plan. Thank you.
Stephen Ellis.
Steve Ellis, 633 Reed Avenue. I think it's important that city council understand the difference between the sort of state level offer or plan for services that we all heard about earlier tonight and the actual degree of service we're able to get in Norman right now. As we heard, there are 2 adult mobile crisis units that cover Cleveland County. One is out of Central Oklahoma Mental Health. One is out of Oklahoma City. That seems to cover the Oklahoma City part of Cleveland County. And there's also a juvenile response team at Children's Recovery Center. I actually went by Central Oklahoma Mental Health and talked with the people who are actually on the team, actually the person who is the core of that team. And it seems clear that their mental health crisis response team is up and running. They actually prefer if you call their main line directly rather than go through 988 because they think they get the information better. So that's 360-5100 for anybody who wants to know. And at night, that just bounces to the cell phone the therapist takes home at night. My understanding from my conversation is as follows. The mobile crisis unit's pretty much a shoestring operation right now. One of the regular full-time therapists just takes a cell phone home after hours and on weekends. It's the same person every night on weeknights, different people on the weekends. There's no real room for expanding response in Norman, at least via Central Oklahoma Mental Health. The therapist who takes the call has to make some judgments about whether or not to actually deploy, in other words, like leave the house to go meet with people. So the situational assessment is usually done via phone rather than any other kind of means. And right now the unit is pretty focused on involuntary commitment issues. So they're not able, just because of the demand, to make the kinds of judgments about wraparound services or anything like that. They're just there to help police officers generally assist in determining whether someone else is a danger to themselves or others. Now, all that's a great start, but it's not what we're looking for, right? We're trying to figure out some comprehensive mental health services, and maybe the state will get there, maybe it won't. They're having a funding problem, obviously. So before we make any decisions about that, I think we should talk about what's actually available in Norman. So I would suggest that some of y'all take a trip down to Community Mental Health on Alameda and ask them about it.
I'll give Jackson Latham one more try. Are you Jackson? Okay. You were just trying to trick me, weren't you? Ashley Roby.
Mayor and City Council for allowing me to speak with you tonight. My name is Ashley Roby, and I'm a citizen of Ward 6. I'm also a friend of Shannon's. I wanted to just touch on a little bit about Shannon as I knew her personally and professionally. Shannon was my site coach for wraparound services at Central Oklahoma many years ago. She helped this very curious and eager young mental health professional to try to help my community in ways that it needed to be helped. I quickly became a coach that also got to do the same role that she did as she moved up through the ranks of central administration with DMH, and we became close friends and colleagues. She was the type of person that would help with whatever you needed. When I went through a premature birth, she was there to offer meals, be a support to me in those moments of my own hardships. And we went through our master's program together for human relations. And we were able to try to gain more understanding and education on how we can help our community. I wanted to express those things because I wanted to paint the picture of who Shannon was. And at the time that I heard about her death while I was working in another town providing training, the news of her death was devastating, and it was it put me in a place of distraught to where I could not do my main job functions. I come here tonight to be a voice for Shannon and to any other community member that may need law enforcement assistance. I appreciate and respect law enforcement. I've utilized law enforcement in my line of work for assistance with crisis calls. I've utilized them on a personal level with an individual I know that was in active psychosis with a CIT officer. No system is inherently perfect, and I come very aware knowing that. And I think it's okay that we take a step back and look at our systems. And even though policies can be followed to a T, that sometimes those policies fall short and do not meet the need of its community. What are the things that we can do? What can we do to come together? Is it iPads and education, awareness, 988, a different crisis response team that it will be in conjunction with COCMHC and DMH? What support can we offer this community to help law enforcement and its community members to not be another Shannon again? Thank you.
Good grief. Christina Owen. Yeah, sure.
Can you hear me? Okay. Christina Owen, Ward 4. Usually I'm extemporaneous on the mic, but given the content of tonight, I went ahead and wrote something down. I'm sad to say that Norman is no longer a place where many people feel safe to even vocalize a criticism of our police department. That alone really speaks to the trust issues we have, the communication issues we have. When you watch the body cam video of Shannon and her arrest, we see why there are trust issues. We keep hearing about all the training that Norman's police department receives, but I don't see it in that video. Where was the de-escalation? Where was the community policing? Where was the compassion? We expect this particular officer to have community policing skills and to be on the SWAT team. But then we also expect him to be able to navigate a mental health crisis as well, with no degree in psychology or counseling, no professional certifications within mental health care, and with no help from someone who has these years of education and experience. Then when he fails to de-escalate a mental health crisis, we blame him for not being two people simultaneously, an officer and a psychiatrist. Our community has a need, and we do a disservice to ourselves and to the police by expecting them to be a catch-all for all things needed in Norman. We need a city-run, stand-alone department for an unarmed mental health crisis response team. We are literally dying in the meantime. It is not illegal.
Please, no, she has the floor.
I only have 2 sentences left. It is not illegal to have a mental health crisis. No one should be arrested just for having one.
Thank you.
Good evening, everyone. Rachel Wyatt Swanson, Ward 8.
I was around initially when this crew proposal came around initially, and it sort of morphed into the Norman Caravans proposal. And we want to thank you for your support of Norman Caravans and the mileage reimbursement. But as you can see, we need to continue our work and forward an initiative for a compassionate response unit for mental health crises. The city of Norman deserves it, our citizens deserve it, and we can't afford to have more deaths in Cleveland County Detention Center. We're not Oklahoma County. We don't want to be. We need to make sure that we protect our citizens at all costs. Thank you.
Dan Sparks. Amanda Gentry. Kathy Wolf. Becca Bean.
Becca Bean, Ward 4. There's a verse in 1 Corinthians that says, "If I speak in the tongues of men and of angels, but have not love, I am a noisy gong or a clanging cymbal. And if I have prophetic powers and understand all mysteries and all knowledge, and have all faith as to remove mountains, but have not love, I am nothing." We are friends of Shannon and Catherine, and we never want what happened to them to happen to your family or to ours. Some in leadership question our responsibility as a city, and our specific duty to keep us safe from crime. That's the job of police officers. But mental illness and needing medical help are not crimes. If the only tool that we have to deal with people in crisis are our police, we have done the sick person and our police officers a disservice. It is not the city's responsibility to perform. If it's not the city's responsibility to perform a mental health assessment, then why do we have scantily used iPads that do just that? When this city approaches a human being, we have the responsibility to assess them appropriately. When we do an assessment, we have the responsibility to make sure that they get the care that they need, even if they refuse it. Once in a facility, we have the responsibility to ensure that our citizens don't die. You also have the responsibility to set police up for success. Let them do their jobs. Allow mental health professionals to be the first people who will respond to a crisis. What is being proposed by the people in our group today is that we do this as a city, because it is our responsibility to fill in the gaps that are not currently being met. I ask you today to serve this community with compassion and courage, because without compassion, without love, all worldly power is meaningless. Thank you.
Thank you, ma'am.
Sherry Gentry.
Good evening, Sherry Gentry, Ward 4. I'm here on behalf of Shannon. She was a good friend of ours. My daughter was like her daughter. She treated everyone that way, and she didn't deserve to be put in the spot that she was put in. We have a mental crisis problem in this city and in our state. We need help. As a nurse, I've worked on the Griffin/Red Rock campus. It's a 24/7 facility. And she could have easily been taken there. Those resources are there. She was not afforded the opportunity to get the help she needed because she was taken to jail. And she stayed there for 10 days without getting the help she needed. We are asking that you, as our leaders, work with us. We're begging for help. We want to see changes. Shannon deserves that. Her boys deserve that because they don't have a mom anymore. And if it was my mom or my dad, your mom, your dad, your sister, how would you handle that? There are so many broken hearts due to the loss of Sharon and Catherine. These families and our community deserve answers. If our policemen need training, let's train them. If they need backup, let's give them backup. Let's get more iPads. Let's do what we need to do. There's so many broken hearts due to the loss of these women, and our community has been shattered. Please help us make the necessary changes to prevent this from happening to another community member who could be, as I said, any of our family members. And I was appalled at an interview that I saw that said it is not the city's responsibility to handle mental health issues. It is our issue. It is everybody's issue. It's my issue. We've got to do better to help take care of our mental illness folks.
Bo Mansfield. No, you're not Bo.
He wants his microphone.
Ashley Brand.
I hope you can all see the tears on my face. My friend is dead. Their friend is dead. For no reason. She's a pillar of this community. And if what happened to her happened to anybody in this room, she'd be right here too. I know two amazing boys that don't have their mom anymore. An LGBTQ ally of the highest level. An animal welfare advocate. My own cat came from her. She fostered my cat. I find it absolutely abhorrent what occurred on the night of her arrest. She never should have been detained by law enforcement. We just sat in that study session and heard about 3 or 4 places right here in town that she could have been taken to. What does it say about our city that she wasn't taken to a place where she could be assessed quickly and stabilized? What does it say about us as individuals when we say, you know what, that's not the city's problem? It's all of our problem. It's my problem. It's your problem. It's your problem. If we don't take care of each other, who's going to? I want justice for Shannon and the others who have died in police detention when they should have been getting mental health treatment. Because if it can happen to somebody like Shannon, it can happen to somebody like you, or me, or my loved one. Thank you.
Bethany Grove.
Let's see if I can do this. Good evening, everyone. My name is Bethany Grove. I reside in Ward 8, and I'm here to speak on behalf of my dear friend Shannon Lee Hanchett. Let me give you a quick synopsis of how we became baking besties. In 2016, I was working on developing a line of Oklahoma-inspired cupcake flavors. I started a Facebook page with just a few followers, mostly friends and family, who were just being supportive. One random day, I had a new follower, Okie Baking Co. They were located in Norman just like me. I thought, uh-oh, someone's checking out the competition. I quickly learned that couldn't be further from the truth. From the moment she introduced herself and called me friend, she called everyone friend. She promoted my page and told everyone I made the pretty stuff, and she just made cookies. But she did so much more than that. She was an amazing mom. She was smart and well-educated. She actually attended OU right here in Norman. She built her family here and made Norman her home. She was a leader and a light to this community, and on December 9th, her light was snuffed out. We are still reeling and left wondering why. I still have dreams, more like nightmares, that I'm able to save her from being arrested in that AT&T store, because I believe that she would still be here today if she would have never been arrested and taken to jail. Let me reference Officer Crawford's own words here. Quote, I contacted the defendant who was exhibiting behavior that was consistent with some type of mental health disorder, end quote. Let's stop right there for a moment. What training or expertise does this officer have in diagnosing mental health disorders? If he believed that was the case, why did he only call for additional law enforcement backup while continuing to escalate her condition by threatening her arrest? According to Norman PD, he was following protocol. This tells me as a citizen of this community, if I find myself in a mental health crisis, I can expect to be tackled, handcuffed, thrown in jail, and left to the mercy of our broken system. We want to pass the buck and say that it isn't the city's matter. The police department in this community, it was the arresting agency. Shannon Hanchett was a citizen of our community, and she just didn't deserve it. She didn't deserve any of this. But, sorry, I'm feeling so anxious that I really want to finish this. I'm going to finish this. She was a citizen, I am a citizen, and I want to make sure this never happens in my community again. If a licensed mental health professional would have been dispatched to assist that day, my friend would still be here. Sam and Cooper's mom would still be here. It is our responsibility. It's your responsibility. It's our responsibility as a community. Let's leave it up to the experts. We're hearing from the experts. They're telling us what we can do. We have so much information out there and people in this community that can help us build what we need.
Thank you, ma'am.
Kate Bierman.
Ward 4. You've heard a lot of people speak tonight who don't normally come here. In fact, some of them have never been here. And they came here to share stories of how they or their loved ones have been treated, not at the hands of other agencies in other forms of government, but at the hands of our police department. Some have said recently that health care is not the purview of the city of Norman, that our charter doesn't allow it. The last lines of the charter say specifically, the city shall have the power to enact and enforce all ordinances necessary to protect health, life, and property, and to define, prevent, and summarily abate and remove nuisances, to preserve and protect and enforce good government and order, to protect the lives, health, and the property of the inhabitants thereof. I'd also like to remind this body, if you're thinking about whether or not that's true, we also have a public trust health system run by this very community. So yes, we very much do engage in the business of health. Very much so. And what you heard tonight is that while we have some legacy programs and some new programs that are rolling out, they are not only not comprehensive, but the gaps in them have proven to be fatal to members of our community. And as a woman, it also concerns me because in this state, women have a higher rate of incarceration than men and do not receive the same level of treatment that men do. And so I think it's important for all of you to recognize that you cannot avoid responsibility for the role the city plays in this. I will be working to find out exactly when these new iPads were requested, and I know that many people will be coming back over and over again throughout this budget process to ensure that you all continue to hear stories of how people are being treated at the hands of Norman PD right now. Not a long time in the past, right now. And so everyone here does have a responsibility, and we're going to continue working, hopefully with you, to make sure that that happens. And we'll be doing so at the county as well, because we think that there needs to be a lot of partnership involved. And right now there isn't. There's a lot of speaking over each other, pointing past each other, and trying to look away from the responsibility that we have as a community. And so I thank you all for this study session, and I hope that you will continue this in your budget process, because if you can find $300,000 to purchase a Bearcat, you can find it in yourselves to find several $100,000 for compassionate response that doesn't require incarceration in order for people to receive the mental health treatment they need.
Marta Burcham.
I actually don't live in Norman anymore, so I'm going to yield my time to somebody else. So I love Norman, as you know, and I'm here to support Shannon and for Fresh.
Good to see you, Marta. Matthew Clinton.
Matthew Clinton, Ward 4. I came tonight to ask a question of our city regarding the arrest of Shannon. Are we a community who wants to be arresting women who call 911 for a welfare check on their children? To me, that's not a crime. When our citizens are distressed, we need to offer help, not handcuffs. If it's true that the police followed protocol, then it's clear that the protocol needs to be changed. I urge you in the city to look into Shannon's case and take action. Thank you.
Thank you, sir.
Laura Deskin. Flora Ellis. Would you like to use the wireless?
Yeah, there's one on there.
Is it, see if it's flipped off.
Okay, there we go.
No,
There we go? No?
it's still not on, I don't think.
Hello?
Yeah, there you
Okay,
go.
cool. Hi, Flora Ellis. This is also a response to the recent deaths in our local jail. As others have said before me, it is in no way appropriate to take someone having a mental health crisis to jail. Being sick and scared is not a crime, and it would be like arresting someone for being sick in any other way. And I'm sure you know this, especially after all the stories that have been before you. Our officers need to be able to recognize the difference between being scared and purposefully preventing an investigation. Further, if they can't or won't be trained, someone else needs to respond to these calls. But no matter why someone is in jail, why they're there, or who they are, they should not be dying in our care. There's clearly a duty of care there that is not being met. No matter if there is an official report yet on Shannon and what happened with her, we need to make changes because we can implement changes now. We can look through what our community is doing and implement change. And while all the talk in the study session was great in theory, of course, implementing mental health care in crisis is a good idea, but with iPads handled at the discretion of police officers who have even admitted that they are not well trained for this, it's clearly not good enough. As well, those speaking in the meeting urging that the system was working well seemed a little bit out of place with what has happened recently here in our local jail. The deaths of 2 community members. Even if the jail has different systems of mental health services than the 988 or the iPads listed in the local with the police officers, clearly one or all of these systems is not working. We need to review the ways that we run these things and we run mental health care in our community and do better. Thank you.
Thank you, ma'am.
Cynthia Rogers.
Cindy Rogers, Ward 4. Tough to follow your kid, tough act. So I would like to follow on the same theme regarding Shannon and Catherine's death. It absolutely is the city's responsibility to see that we aren't harming people and that our procedures and policies don't lead to people dying. We would never say that it's not our responsibility to show up at a car wreck and save whoever's there, whether it was their fault or not. And I'm not saying that mental health is the same as a car wreck, but to somebody experiencing it, it is an unavoidable something that happens to you that you may have little control over. So I take offense to claiming that the city has no responsibility. At a minimum, we have responsibility to make sure that being sick doesn't lead to being a criminal. And that's where council can step in and take charge of police protocol and policy. It is your job, and make sure that we're not criminalizing being sick and being in crisis. I don't like, and I'm sure the police don't like, that they get called in to do things that they're not trained for. I would be uncomfortable if I had to show up and someone was in crisis, and I'm not trained in that way. And I think it's completely unfair to expect them to know how to behave and respond in crisis situations when they're trained to take control. Like, these are things you can't control. The person in crisis can't control their responses. They can't comply in the way that somebody who doesn't have a crisis happening to them would. So I implore you, we don't need to wait for an investigation. We know there's a problem with our policies. Make the changes now. Let's not let another Catherine and Shannon happen. We have resources in the community, so let's use them and let's find ways to bring more resources. Hopefully the county will do their part. Thank you.
What I'm going to do is adjourn this meeting, and then at 8:30, I couldn't see the clock for some reason. At 8:30, we will adjourn in the other room for executive session.
Let's go ahead and do this.
You want to do this? I'll entertain a motion to adjourn out of city council meeting and convene into executive session.
So moved.
Second.
I have a motion and a second. Motion on the floor is adjourn out of council meeting and convene into executive session in 10 minutes. Council members, you may cast your vote. We're good?
Kelly, did Kelly get up? Kelly, vote.
Vote. Wake up. All right.
Votes have been cast and the motion to adjourn out of the city council meeting and convene an executive session passes unanimously.